welcome to everybody to today's adult social care and health scrutiny budget meeting. It's a few reminders for everybody here. Firstly, this meeting is being live streamed, so please use the microphones and have them pointed at you when speaking. Please can you ensure that you address everyone by their full title of councillor, no first names please. And a final reminder to not hold individual discussions whilst other people are speaking. I'd like to welcome Ruth Saltmarsh from our Standards Committee, who's here to observe today's meeting. So welcome, Ruth. Thank you. I would like to move now, please, to apologies. Fred.
Thank you, Chair. So we've had apologies from Councillor Davies, but we've also got Councillor Morgan attending online, and also Cabinet Member Councillor Cottle-Hunkin is online as well.
Thank you. We have no public participation today in this budget meeting. So now if we could move, if we could go to declarations of interest, please. Members, please declare any interest you may have either now or before discussion takes place on the relevant item. Councillor Ketchin.
I work in the NHS at the RD.
Thank you. Thank you. So if we could now move to the main item on this morning's agenda, which is a budget 2026-27 and capital programme for 26-27 to 2030-31. So we have a joint report of the Director of Finance and Public Value and the Director of Integrated Adult Social Care and the Director of Public Health and Communities here today. And we've got the following officers, I believe, in attendance. So we have Angie Sinclair, Director of Finance and Public Value. Welcome, Angie. We have Matt Thorpe. Hi, Matt. Deputy Director of Finance and Public Value. Lisa Evans, Head Accountant. Catherine Long, Assistant Director of Finance. Helen Layton. Sorry, Paul Bartlett, Deputy Head Accountant. Where's Paul? Hi, Paul. And James Bukowski, Cabinet Member for Finance, and Richard Keeling, Cabinet Member for Adult Social Care. Plus we have Tandra Foster, Director of Adult Social Care. Sove Wright, Amy Howard, and Steve Brown, Director of Public Health. Welcome, everybody. So I don't know who's going to start. James? Sorry, Councillor Bukowski.
Thank you, Chair. Good morning, everybody, members. Councillor James Bukowski, Cabinet Member for Finance. Chair, this report is part of the Council's 2026-27 budget setting process, and I want to begin briefly by setting out the national context in which it has been prepared. Adult social care continues to face significant pressures nationally. Demand is rising, costs are increasing, and workforce challenges persist across the sector. The ADAS survey show that many councils are struggling to balance their adult social care budgets, often relying on substantial savings simply to remain financially sustainable. Progress on national reform remains slow, and in the meantime, councils are required to meet growing statutory duties within a constrained funding environment. The government's move to a multi-year settlement is welcome in principle, as it provides greater certainty for planning. However, it is important to be clear that this does not represent a step change in funding for adult social care. Increases in core spending power are driven largely by assumed council tax increases rather than additional government grants. When council tax is stripped out, funding is broadly flat in real terms, with clear implications for both this year and the medium-term outlook. Against that backdrop, adult social care represents a significant part of the council's finances, forming the single largest service area within the budget. Decisions in this area therefore have a significant impact on the council's overall financial resilience. It is also worth noting that adult social care is a service that many residents do not directly encounter or think about in terms of council funding until they or a family member need support. When that point comes, the council has a clear statutory responsibilities to meet eligible needs, often in complex and high cost circumstances. Much of the pressure in this budget reflects that reality. This report, therefore, should be read as a measured and realistic response to national constraints and local responsibilities, maintaining financial discipline while continuing to meet statutory duties. I will not go through the detailed figures at this stage. I will hand over to our head accountant, Lisa Evans, to walk the committee through the technical aspects of the report. And then after that, the portfolio holder, Councillor Keeling, will introduce the service detail. Thank you, Chair.
Thank you very much.
Thank you. Good morning. The scrutiny pack you have before you represents the budget proposals in respect of integrated adult social care. The key tables within this paper, they will form the basis for the information presented in the published annual budget book. The introductory report sets out a 26-27 target budget of 839.2 million for the whole authority, as agreed by Cabinet on the 14th of January 2026. More specifically for this meeting, for integrated adult social care, the target budget is 395.9 million, which is a net increase of 9.9 million or 2.6% compared to the 2025-6 budget. The introduction and the commentary, provisional local government finance settlement 26-27 and equality impact assessment sections of the introductory report are relevant to all committees. Service specific budgets issues and the capital programme are relevant for this committee. The report is followed by a senior leadership commentary which sets out the scene for the council as a whole. Additionally, individual directorates have their own commentary summarising the services provided, their performance and any significant challenges faced. Each directorate has a summary table demonstrating how the 2026-27 budget has been built up, an analysis of total expenditure and funding streams which goes on to list any self-funded services and relevant statistical information. The service statistics highlight key activity drivers identifying the impacts on activity that plans and assumptions informing the budget are expected to have. The papers include financial detail at service level, showing how the 2026 revenue budget has been constructed and explaining key movements from the current year. These will include the estimated impact of inflation, national living wage, demographic growth, contractual or legislative pressures, and any other service developments or investment. Likewise, it will list proposed savings that inform the budget. Assumptions and estimates, including those for income generation, have been developed with operational senior management teams. Any significant risks to achievement or potential volatility are highlighted on a service-by-service basis in the risk assessment section of the scrutiny pack. Please note that anywhere figures are shown in brackets indicates they are either income or a reduction in expenditure, both of which have the same effect of reducing the net budget. Towards the back of the scrutiny pack are consolidated tables detailing the grants Devon County Council has agreed to issue to external organisations and an analysis of the staffing data. In addition to the 2026-27 budget, the medium-term capital programme is also included. It is worth noting that the annual budgets may not total the scheme approval figure, as the scheme may span a period outside of the current 5-year programme. For convenience, the final pages of the scrutiny pack provide a list of abbreviations. Thank you.
Thank you. Councillor Keeling.
Thank you, Chair. Councillor Richard Keeling, Cabinet Member for Adult Social Care Services. First, Chair, I would like to thank the Director of Integrated Adult Social Care and her staff for the report, and I'm happy to talk to that. Integrated adult social care represents the single largest area of council expenditure and carries the greatest strategic importance. The service faces growing demand, increasing complexity and workforce pressures, while also leading key transformation initiatives aimed at supporting independence and reducing long-term reliance on statutory services. The 2026-27 budget reflects these pressures and invests in continued improvements, strengthened pathways and redesigned model of integrated delivery with Devon. The Savings and Transformation Programme, the 2026-27 savings requirements stand at £21.1 million across the integrated adult social care. Delivery depends on the success of the Living Well in Devon transformation programme undertaken by Newton. which embeds strengths and best practices, redesigns workflows, data-driven decision-making and modern commissioning approaches. The programme represents the most significant operating model redesigned in over a decade, shifting the focus from long-term commissioning care towards independence-focused interventions. I will be able to talk more about this in the report before you this afternoon. Colleagues, key risks include NHS costs shifting, delays arising from statutory consultations, rising unit costs and market instability. The savings programme requires strong partnership with NHS Devon, co-production with providers and consistent implementation across teams to ensure the benefits are realised and embedded. Madam Chair, I'm happy to answer questions afterwards, but I'd like to pass over to our Chief Executive, Donna Manson.
Good morning, members, and apologies, I've got a back injury this morning, so I'm unable to sit down. So anyway, so apologies. On page 49 of this paper, we talk about ongoing NHS reforms, significant financial and operational challenges. We've been working with our NHS colleagues here in Devon, many of us in the team, for over 3 years now, and I have never been so concerned about what's happening in the NHS locally, both at Children's Scrutiny and today. Our ability to be present in governance structures is not there in the new ICB structure. Devon is excluded from that. As local government colleagues across the peninsula, we have expressed as chief executives our concerns to what's happening. Many colleagues that we've worked with previously in the Devon ICB are not going to be part of the new structure set by government, and I'm concerned at a governance and representation level. The leader's not here today, it is another meeting, but he has, with the deputy leader, been in meetings with myself to express to the new chair that concern. Equally so, I would describe that the savings that are expected in NHS Devon are unreasonable. I do not think they're deliverable at the pace expected, and I genuinely think that a case of additionality and exceptionality should be made for Devon NHS. We have a number of meetings set up, but I do think that risk needs to be articulated strongly and clearly today. Our colleagues are working hard in the NHS, and we work strongly together, but there is just not going to be enough people to work alongside us in the new structure to get the job done. So I wanted to highlight that to the committee today. The other risk here is that, and it's highlighted in the papers, is the fact that we are working with an external partner in this process, because we need to make internally significant cultural challenge to what we do. To date, I have met with that external partner from the set-up of this transformation throughout the months of setting it up, and I'm working with Cabinet and continue to meet with them on a regular basis. I am delighted to report that that external partner has said that the staff in Devon County Council are working exceptionally well with that external partner, because this is a massive change for how our staff work in terms of what they do with our communities. So on a positive note, I'm delighted to have that feedback, the work that the director and the team have carried out, the ongoing work that we've been doing in culture, led by the People and Culture Directorate, the very positive, spoiler alert, but a very positive staff survey that we've just had from our staff, all indicates that staff are in a good place to take part in this transformation. And finally, just to say that I do think we have to look at this transformation, not just as an adult social care transformation, but with the deep transformation that's taking place in SEND and in children's social care in Devon that is evidencing a really positive trajectory. But those young people will come into our adult social care system, and I think it's something for you members to consider how we begin to join the dots and see vulnerable people not as children or as adults, but as families, and what kind of governance is required to make sure that that SEND transformation, the transformation of one case management system for children and adults, which is taking place this year, and what you see in front of you today for adult social care, that there is a place in governance to make sure that that is all connecting up, because it's only if all that connects up and happens at pace that we can deliver what's in the papers today. So it is high risk, many things for us to think about in both governance and delivery. But I'm absolutely delighted that what I've observed, finance colleagues, at least on the team, are very much bedded in with the adult social care team on a weekly basis. Myself and the Director of Finance and Director meet regularly with the NHS when they can be there, and with senior colleagues. So there is a strong foundation of people working together, but we will need additional oversight and governance so that we can share with you at any point where this transformation trajectory just is maybe not happening, and then how we get your support in that. So just sort of important to set out that context for you to consider. Thank you, Chair.
Thank you very much, Chief Executive. So I think we're going to first of all look at, I think there's been a request that we look at the public health aspect of the 26-27 budget. Committee, now's our opportunity to ask Steve Brown and Councillor Cottle-Hunkin any questions. I don't know whether you want to make any comments from the outset.
I think Chair was going to do introduction, Chair, online.
Thank you. Hello, Councillor Cottle-Hunkin.
Hello, can you hear me okay?
Yes, thank you.
Thank you. Cheryl Cottle-Hunkin, Cabinet Member for Rural Affairs, which includes public health. As members will be aware, Devon County Council receives a ring-fence grant from the Department of Health and Social Care to deliver its public health duties. This year, I'm pleased to say that we have received a provisional 3-year settlement. In the past, we have only received annual allocations, and often we receive these very late in the day, making budget planning extremely difficult. In recent years, central government has issued additional short-term funding to public health to support delivery from the National Drug Strategy and the delivery of the Smoke-Free Generation Strategy. From April 2026, these previously separate grant allocations have all been consolidated into the overall public health grant. Spending against these specific programmes will remain subject to close scrutiny to ensure there is no reduction in spend. In essence, these programmes will be ring-fenced within the overall public health grant. The vast majority of the grant is spent on commissioning and/or delivering core public health services, including health visiting and school nursing, drug and alcohol services, NHS health checks, sexual health services and smoking cessation, which the local authority is required to provide. We continue to see a rise in demand for the public health services, alongside an increase in delivery costs associated with rising staffing and treatment costs. The public health budget is presented as a balanced budget for the year, with utilisation of the Public Health Reserve to support cost pressures and related services across the authority that deliver public health outcomes, including expenditure within libraries and the youth service. Happy to take any questions.
Thank you very much. So I'm looking at committee members. to see who would like to ask Councillor Cottle-Hunkin or Steve Brown any questions. And as we go through, I think we have scrutiny officers here who, as we go through the questions, will be looking at bringing forward recommendations so that as a committee we can put recommendations to Cabinet. So I think Councillor Ketchen has his hand up.
I just found the accounting side of this quite hard to follow. You suggested this is a cost neutral slant for the year compared to the previous, but on page 3, which is sort of the big overall budget sort of overview, there's a sort of an 8% drop in that public health and communities budget. It's mentioned as sort of touching 16 million, whereas later on it's referenced as 35 million. I'm very unclear as to how this budget is presented and what these cuts or cost neutrality mean. So maybe it's just my ignorance.
Shall we?
Thanks, Chair. The reduction that's mentioned in the opening report relates to the whole of Steve Brown's directorate, which is public health and communities. The public health budget itself is a net nil budget, so in effect the expenditure is fully funded from grant income, and in fact the overall position for public health is that the income has increased by £1 million in 26-27.
Can I ask a question, please? Paragraph 8.2 says that the public health reserve at the end of 24-25 stood at 11.6 million. And I think it goes on to say that the reserve will be used to support cost pressures and related services across the authority that deliver public health outcomes. So my concern is that obviously reserves are finite and it's one amount. So my question is that what do we go, well, it's several questions. What will we do when that reserve runs out for the services that it's going to be funding this year? And why can't, we've got a 3-year settlement from, well, we'll have from the government. Can we not spread it out over 3 years? And how does the Director of Public Health feel about using that reserve?
Thank you, Chair. You're right. I always teach my kids a lesson. You can only spend £1 once. So once you spent it, it's gone. We have a reserve, as you indicated, about 11.6 million. Much of that was built up over COVID when we had more money. For me, it's never good use of reserve to bake that into a revenue fund. So from my point of view, it's about using that reserve around transformation. So how can you use that reserve over the short term, 1, 2, 3 years, for example, to think about how we can transform services across the public health domain. So I'll give you a couple of examples. So one area where we're looking at utilising the reserve from is a new clinical database system for public health nursing. So again, it's kind of spread over a couple of years, I think, Dominic, in terms of using that money. But again, we are convinced that will drive efficiencies and transformation within that service. Money which we can only spend once, but it's kind of useful for that. The other area looking at spend is around, for example, our youth service or libraries, where you can indicate in the paper if we put some additional funding in. But again, you know, we need to look at how do we create those services to be sustainable going forward. The reserve's the reserve. We've profiled it over 4 or 5 years. Central government, Department of Health and Social Care, expect us to have a small pot of funding in the reserves for the just in case incidents which you have. And we've profiled that over the next 4 to 5 years to make sure that we don't go down to below that line, about 5%. So for me, it's about using it wisely. How can we use it to transform and drive efficiencies out of services? How can we use it to buy technology, again, to drive efficiencies out of services? But you know, recognizing we can only spend it once. So we need to really profile that spend as we go forward. And you're right, the 3-year settlement will help us, albeit, we haven't got it confirmed yet, and we still don't know whether there's going to be any additional burdens. But for the first time ever, we're allowed to kind of plan ahead over the next 3 years with our revenue spend, which is a fairly unique position for us in public health over the last 10 or 15 years or so. Thank you.
Thank you. Councillor McGough.
Good morning, Chair. Thank you. Just a quick one here. The reliance on reserves to achieve a balanced budget. The draft budget appears to depend on the use of reserves to balance the revenue position. While this may achieve short-term balance, it marks underlying structural deficits. Using non-reoccurring reserves to support reoccurring expenditure is not a sustainable strategy and exposes council to heightened financial risk in the future. Can you explain to me? I don't believe that 3 years is looking far enough in the future for a council's budget. So I just looked at the team, please. 3 years to me in business isn't a really good format of going forward. So, you'd go at least 5-10 year term. With a council of our sort of size, with a regular sort of budget coming through from the council tax precept, we kind of know at least 5-10 year period where we would be going, where we project to go. Nothing to do with LGR. I don't want the LGR used in front of this meeting for me, please, as an excuse to not balance our books. I think government totally irresponsible for even suggesting we go into LGR, because it doesn't help the taxpayers of Devon. So I got a few more questions after, Chair, but I'll leave it at that for a moment, please.
Councillor McGough, is that a specific question on public health, or is that a wider question about reserves?
Well, to be honest, it affects public health, doesn't it? If we're using reserves for public health, it affects all the residents of Devon. And where does the reserve money come from? It comes from the taxpayer's pocket. So once you start using reserves, you've only got a limited pot. Therefore, where do we replenish these reserves to? Again, taxpayers of Devon, they've got to put your hands in your pockets, unfortunately, again, and pay again.
Thank you. Who would like to comment? Steve?
Thank you, Councillor McGough. I won't play back what I've just said around the question from the chair, but you're right. So our funding comes directly from Department of Health and Social Care. That's up. I mean, as I said, the first time for a long time we've had a 3 year settlement. Normally, I'm sat here in front of Scrutiny, not knowing what my budget is for the coming year. That's how late often it is. So you forgive me for being pleased that I've got a 3 year settlement. Ideally, a 5 year settlement would be great. In terms of our profiling of the reserves, that's over 5 years, you're right. And if I could do it for 10 years, I absolutely would. We still don't know what our final budget's going to be for the 3 years, because it's only provisional, and we don't know what additional burden. So I'd absolutely concur. The longer we have that forecast of income from the Department of Health and Social Care, the easier it is to plan. Because as with most of our services, as the chair indicated, they are commissioned out: drug and alcohol, sexual health services, public health nurses. And you'll see on the report, one of the areas where funding has come down, because we've gone through a procurement exercise, is around sexual health. That's not about reducing the number of services we have available. That's about consolidating and having really good commissioning. So we can do that because we can plan ahead. We know what our budget's going to come. If we can't, it makes it very, very difficult. And, we haven't said it today, but I've said it on many occasions. The budget I received from the public health grant is one of the lowest in the country. We get £39 a head. If we put a league table from 1 being the lowest to 140 being the highest, we'll be in the bottom 5 or 6, well in the relegation zone for those who follow matches. So there is for us around how we can balance that budget in large rural communities when things like sexual health, drug and alcohol, public health nursing cost us more to deliver those services in large rural communities. So it hasn't been said yet, but I just want to put on so members are really clear that our grant allocation is extremely low when you compare to our neighbours or the rest of the country. Thank you.
Thank you. I think Director of Finance Angie Sinclair would like to come in at this point.
Thank you, Chair. I just wanted to add a bit of clarity for the committee that Devon's council tax does not contribute towards the funding of public health. It is entirely central government grant. The County Council's reserves are not being used to support public health, either on ongoing or a one-off basis. The Public Health Reserve is a ring-fenced statutory reserve that has been built up in the past from public health grant. And the use of the reserve is for one-off projects for Invest to Save to help transformation, but only where they meet the outcomes of the public health grant ring fence terms and conditions. Thank you, Chair.
Thank you for clarifying that.
Yeah, lovely. Thank you very much for that. Chair, I'd just like to thank the officers actually for giving us the documentation really early. I find it really helpful. You can actually go through it and get some, obviously you can kind of preload your questions you want to do. So I find it is pretty helpful. Thank you. Just one more from me at the moment, please. It's the lack of published health impact assessment, HIA. There is no clear accessible HIA shown how the proposed budget would affect major detriments of health, including poverty, housing, mental health, transport, and access to care. Without this, the council risks breaching its obligations under the Health and Social Care Act 2012 to consider health inequalities in decision making. Now, I think this kind of highlights the point. You know, the tax doesn't always come from central government because it comes from us first. The money goes to central government. So where I try and speak in the part of the residents of Devon is, you know, we pay our council tax. It doesn't just come to our little pot. It goes to central government, it comes back to us. So it is appropriate for this meeting. Chair, can I just add, you know, when the public see this, Chair, you know, the public needs to know in kind of layman terms where we're going with our budgets. All the graphs, figures are lovely. If you're an accountant, it looks brilliant. They're quite easy to understand. I give you that, but to some members of the public, it may not be that easy to understand. It's a bit more layman terms approach so the public actually see what we're doing, more transparency, I think. As in, when I say transparency, don't please don't say it's offensive. Just be more open to the public, engage better with the public where you can break it down easier so we can actually look at the budget and think, right, it's not so much gobbledygook, just get it straight points to us. You know, public want to know straight what's going on with the budget. I think that's easy.
Steve?
Yeah, I mean, I can answer part of that, I think, question. So in terms of some of the areas where we've increased our expenditure, for example, with the substance misuse. So Cabinet's decision earlier this month to increase the funding associated with it with the budget was accompanied by an impact assessment to support that particular decision making. So I don't think for public health we have anything specific in here which will have a HIA associated with either increasing or decreasing some of the budgets. I can't speak for social care though.
Does anybody else want to comment on the public health before we move on to the remainder of the budget?
Thank you, Chair. In terms, I welcome the focus on drug and smoke, trying to reduce that. What's the view on vapes? We're seeing more people vaping, obviously disposing those vapes and causing other risks in fire safety. Our district health colleagues. I know we linked this strategy with what GPs are doing on those subjects as well.
Steve?
Happy to respond to that. Thank you, Councillor Rogers. So the committee would have me say this on more than one occasion. So the national drug strategy is the national smoking strategy is focused on those current smokers to try and get them to quit smoking, because we know it's the single most thing which anyone could do if they smoke to improve their health outcomes. So the funding around smoking and tobacco is just that. We do know that vaping is one tool. There are many tools to be used to support individuals to shift from smoking tobacco to vaping on their journey to quit smoking completely. We know that vaping, it comes with its harm. It's not harmless. And anyone who doesn't smoke, we would not be encouraging to vaping at all. It causes harm, particularly for young people. Some of the allocation we are using to support around creating a service to support young people around stopping vaping. But much of this funding is around the thing that we can do, the biggest thing we can do to improve someone's life if they smoke, to stop smoking. So there's vaping in it, but the national drug strategy, that's twice that, the national smoking generation strategy is focused on trying to get those smokers smokers to stop smoking. We know it's the biggest they can do to improve their health.
Is it a budget question?
Do we have data as to how many young people are vaping and the impact that's having on us as an authority and the health service?
Steve?
Yeah, I can give you the most up to date by it's about 7 or 8%, but I'll find that from 8% we've seen an increase, but I'll get the data for you. That's probably a national figure, Councillor Rogers. In terms of the impact, we know nationally we are seeing an increase in hospitalisation, for example, with young people. The numbers will be really low locally, but I can find out whether we've got any data around in our local NHS, unless Lex, you've got any information.
Just to say that the data is actually incredibly hard to collect because it's a what's the word I'm trying to, but also that young people aren't honest about whether or not they're vaping because it's a prohibited activity. So we have estimates, but they're not they're limited in their validity.
Thank you very much. Has anybody got any other budget questions for Steve or Councillor Cottle-Hunkin? Councillor Dawson.
Thank you. Yeah, I wanted to, you've mentioned a couple of times about the any sort of unknown burdens. I wanted to kind of hear a bit more about that, please. And then when we're looking at the reserve, you mentioned any sort of unforeseen issues or campaign, you might not have used the word campaigns, can't remember what word to use, but any sort of unforeseen incidents or something that needs funding. Could you give us examples of that and also just kind of clarify about the unknown burden, please?
Thank you, Councillor Dawson. So in terms of the unknown burdens, so in the past we've received grants, and often it's relatively small allocations of money, but I'll give you one example, and this isn't going to be the absolute right terminology, but we received some additional funding which we had to passport through to our training standards in order for them to go and inspect the regulation of cosmetic surgery and lip filling plants, so injections. So that's an example where suddenly we're thinking, well, it's not a public health responsibility, but it's not uncommon for central government to use the public health grant as a vehicle to get money down to local authorities and then say you need to do some work around this. So I don't know precisely what might come ahead, but there might well be things. And in the top of my head, there might be things around things like gambling, for example, which might be a topic. So whatever the central government have on their current agenda, sometimes some of that requirement gets passported through to us to do, and they often use the public health grant to do that. I don't know exactly what if anything it will be this year, but it wouldn't surprise me if something like gambling might be an example where suddenly within your public health grant there's a notional allocation to do X or Y. So that's potentially a burden. In terms of some of the reserves and incidents, and Lex might want to speak to some of this in a minute, but obviously we have responsibility around protecting the health of the public. So if you have incidents like outbreaks, for example, sometimes we're asked to step into the space to support for vaccinations, for example. So I don't know, Lex, whether you want to say anything specific around health protection.
Yeah, well, health protection, I'd also add other, so synthetic opioids, for example, are a dramatically increasing risk nationally and locally. And so if we had to respond to a increased risk, say from an adulterated batch in our local area, that needs quite a specific response in terms of pushing out naloxone, pushing out support for those individuals that we would, certainly in the first instance, need to be able to fund immediately.
Thank you very much. Thank you. Councillor Julian.
Thank you, Chair. Have we, do forgive me if I've missed it, but have we made provisions? Because obviously with social care, people coming of retirement, and there's a gap. So are we having apprenticeships working alongside so they get the experience so we can carry on with looking after people in such rural areas? Because I have been to some of these meetings where we're not advertising enough to get people to take over from people that have retired. So have we penciled in extra provisions of monies to keep it going in the rural areas? Because I think that's critical, because we're going to have a massive gap soon, and that'll be a nightmare if we have to start to have outside bodies taking over, which costs the county a lot of money. So if somebody could tell me about that, please.
Is that a specific public health question?
It is, Chair.
Steve?
Thank you. Yes, thank you, Councillor Julian. It's a really good question. We know our workforce profile age is often to other 50 plus, and I'll use it just as an example, Chair, but our public health nursing service, so our health visitors and school nurses, when you look at the age profile that we have a disproportionate are my age, over 50. So how are we bringing the next generation? So you absolutely mentioned apprenticeships, which is, you know, exactly one of the routes we're doing. So we got, I think it's 15 apprenticeships starting over the next 12 months to try and start to bring in the next generation, so we don't have a cliff edge as staff leave. Wherever they will, they retire. We've got a new cohort of people coming through, and I suspect it's probably not too dissimilar in adult social care.
Thank you very much. Any other questions for Steve or Councillor Cottle-Hunkin? Councillor Tilsey.
Thank you, Chair. I wanted to welcome the clarification from the Director of Finance. Thank you about the reserve. And the question is about the reserves. Is there a risk if we do use it as part of a transformation project and invest in public health for the 4th year from now, after our allocation? Is there a risk that our funding will be reduced because we have used our reserves? Is there a risk that they'll see that we're able to pay for things ourselves? Thank you.
Thank you, Councillor Teaser. A really good question, and I say this because in my career it has happened before. Back in 2016, the government just pulled all the reserves from all the public health areas and said, we'll have that, thank you very much, you don't need that. That's not been the case in the last 10 years. So what's been really clear, as Angie pointed out, is the reserve can be spent and should be spent, but it only can be spent on the public health services. So Angie, myself and Councillor Cottle-Hunting will be scrutinised every year. They come down and look at our expenditure, and we absolutely go over it with a fine-tooth comb to make sure the reserve and also our revenue is spent in accordance to the grant conditions. So I don't foresee that as happening in the foreseeable future, but it has happened in the past under separate government, so it's not impossible.
Thank you.
Thank you. Any other questions, or shall we say thank you to Steve Brown and his team and, oh, Chief Exec?
On a technicality, Councillor McGough does have a point in terms of health inequality impact assessment. So I'm just going to refer to the Monitoring Officer and the Director of Finance, because I don't think it is explicit enough in terms of paperwork in front of you. So that's the joy of scrutiny, is actually when we need to change something. And just to say that monitoring of the public health grant is a big meeting for us, and the Cabinet Lead for Finance will be there along with the Cabinet Lead for Public Health. We do get a letter following that visit that confirms that we are using the public health grant appropriately. So I'm quite comfortable about that being shared in terms of for transparency, because I think it's a very good point today, and also just so that for that point of understanding for everybody in the room, that it is subject to certain conditions, national governance that sits separate out with this organisation. We got a very I'm happy to share with the Chair and the Vice Chair as an example, to share with the committee members the letter that we received last year following that visit, because you will see how much scrutiny is put to the use of the public health grant. But I think if the Monitoring Officer and Director of Finance could respond to Councillor McGough in terms of very valid point.
Thank you. So currently it is picked up at pages 14, 17 and 26 in the EIA, but only so far as health inequalities. We will strengthen that within the budget impact assessment and ensure that that is in the final papers and considered. Thank you.
Thank you very much. So, Councillor Dawson.
Sorry, just one last question about that reserve, because I'm all for using part of the reserve to kind of for future resilience and transformation, for particularly for public health services. What is, it stands at just over 11 million, did you say, at the moment? What is going forward in future years, what is a comfortable reserve to have? is this slightly on the higher side? So is there quite a lot of wiggle room at the moment? You said you built up some during the COVID times. Going forward, what is a comfortable kind of range for that reserve, please?
Thank you. Good question. So the guidance we receive from our regional colleagues is about 5%. My view is it's about risk. But if we have that 5% in your head as a kind of I suppose, a floor if we want to get to, I'm trying to do my maths really quickly, Paul. So that's probably about nearly 2 million, so 1.5 to 2 million. So you can see where we're currently at, and that trajectory over 4 or 5 years to get to that point takes us down by a couple of million every single year as we get to that kind of 5%. But it's a risk-based one. What are we comfortable with? What's the risk of something major happening, and we have to delve into that reserve. But if you talk about what's comfortable, that would be about right, I think.
And then I was just also going to ask, it just left my head entirely. Oh gosh, I was going to ask about, you talked about underfunding, and that if there was a table showing from 1 to 140 about funding for public health services, Devon would be in the bottom 5. What can we do about that? What is already being done, and what can be done about that? Because I think it's something, as councillors, and I'm newly elected from May, don't know how long I can get away with saying newly elected actually, we're hearing that quite often about Devon in all sorts of areas. What can be done public health wise? What politically could be done? What can senior officers be doing? What can we be doing as a council body to get us higher up in that chart, please?
Yeah, thank you for the question, and underlying that your support for getting more money. Just to put it in some context, and it's difficult, but if we were to get the average, so we were to kind of that would be an extra £25 million for Devon County Council. So that's a significant amount of money. So obviously welcome members' support in terms of Department of Health and Social Care, asking for a relook at the public health grant. Every year we ask them, whether it's through scrutiny, to relook at the public health grant and to take adjustments in terms of inequalities and ruralities with providing a service. I regularly talk to my colleagues in region and act with the Association Director of Public Health about a rebalancing. As one can imagine, a rebalancing while the envelope is the same means some of my colleagues will have to give up some of their funding, and that's more challenging, as one can imagine. But for me, how can it go from, I think, about £37 to £38 per head of population to, I think, £1.50 per head of population to deliver public health services, when some of those core services like health visiting, school nursing, sexual health, are broadly the same as well. So anything which the committee would welcome in terms of writing to represent our views that we think the public health grant should be relooked at, that would be welcomed, and I will continue to do all I can to bang the drum. I do it regularly around the allocations we receive and the challenges it is for us to deliver my services across a large rural patch with no recognition of that in terms of our grant allocation with public health. Primarily, it's based historically on what was spent previously, and right at the beginning, 2014, there was a ambition, I suppose, for the then government to come within a target to bring people from the extremes in. That lasted 1 year. It was then ceased then. So we've had this trajectory of variation that's maintained, and there's no variation, that there's no annual trying to get us closer to the middle at all, unfortunately.
Thank you very much. I would certainly support making a recommendation about the poor funding for public health for the residents of Devon. I believe we've done that before as a committee, and I would certainly like to do that again, because it's totally unacceptable that we're so poorly funded for public health, and our residents deserve to be treated equally with residents elsewhere. So I'm hoping that our scrutiny officers can pick that up. Thank you very much. So if we could please now move on. Councillor Rogers.
Thank you. Where are immediate? Where the lower end of funding? Where are our immediate neighbours in the funding graph then?
So if we're talking about Plymouth and Torbay, they get significantly more than us. And probably have it written down somewhere, Councillor Rogers, I haven't on here. Torbay, I think, get twice as much as us, and Plymouth are, again, probably about 50% more than us as well. Thank you.
Thank you. If we could now move on, please, to thank you very much, Steve, and your team, and thank you very much, Cheryl, Councillor Cottle-Hunkin. And if we could now move on to the other part of the budget for consideration. It's an opportunity for all our members to ask questions, and again, to come up with recommendations for Cabinet. So, who would like to ask any questions of our officers or portfolio holder? Councillor Keeling, would you like to make any comments?
I think I was quite clear in my preamble. Thank you, Chair. I'd like to hand over to the Director, who may want to say a few words. Thank you.
Thank you. Tanja.
Thank you, Chair, and it will give my colleagues a moment just to settle into their seats. So before you've got the budget for the year, you will see that there are some definite plans in there. So we are we're looking at 21.1 million that we have to make. Some of that is income, 1.3 million, and the remaining is 19.8 million of savings. The bulk of that will be done through our Living Well in Devon transformation work. And I'm thinking that the updates on that work will come here. As it's detailed in the paper, there's a significant amount of changes to the way that we do things, but the ultimate aim is to reduce costs but still improve outcomes for the people of Devon. So that's behind it all. That's what we are trying to do. It will be tight. 2.6% represents just under 10 million. And adult social care is a demand-led budget. So it's going to require really tight control. We've got a good track record of doing that, but we normally have a little bit more room if things go awry. So this year is going to be quite a challenge, but I do feel comfortable and confident that we've got good transformation partners in Newton. We are doing the transformation with their support, and it feels better that we've got somebody in, given the scale of the target that we've got. Thank you.
Thank you. If I could just start with a question, please. So we know that we've got to make £19.8 million of savings, and that depends on several things. So it depends on the service's ability to maintain focus on the timely and successful implementation of the programme, but it also requires NHS partners to work collaboratively with the council and implement changes to practice and process. What risks are there that we won't be able to meet that £19.8 million savings because of issues not within this council but within our partners?
Thank you, Chair. I'm going to start, and one of my colleagues might want to come in with a bit more detail. So absolutely, our entire programme requires others to support us. Our biggest partner in this is our National Health Service colleagues. And one of the areas that we're looking to improve is hospital discharge. We're already working collaboratively with our partners. So every week I'm meeting with senior colleagues in the NHS to focus on the particular pressures. But also underneath that, we're working together to develop our programme of work. And what it requires is us all to be on the same page, so all to agree what the challenges are and therefore what the solutions are. And that work is ongoing. But absolutely, I think if we're not able to achieve that across the coming year, then that would put that programme of work at significant risk of us being unable to deliver it.
Thank you. And just a follow-up question, are you able to allocate within that 19.8 million, how much of that is absolutely within the council's control and how much of it is dependent on our working with our partners, particularly the NHS.
Okay, so what I haven't done is work out a percentage risk increase. We've done a RAG rating. If you look at the hospital discharge, that requires a shift in how we work. So it will require commissioning of a more effective pathway to discharge process. And we already know what we need to do. And I think across senior colleagues, we agree, but it's galvanizing and getting to work. But there's also changes in how we agree decisions about what happens with individuals. The implications of us getting that in the right way means the pathway itself will be more efficient, more effective, people will flow through it faster, therefore you'll get better value for money. But what we're really focused on is the outcome for those individuals, and what we want to see is the greatest independence. So from a council perspective, where we invest, it's in the long-term care for those individuals. And if the right decisions aren't taken at the right time, people are not put onto the correct pathway, and we are not quick enough in terms of working with them to get them home with little or no care or get them therapy, etc., then there is a risk that the council will not be able to achieve its savings identified against that. Is that helpful?
Thank you, that is helpful, but I think I'd like to hear from finance how much of that, specifically in terms of numbers, how much of that 19.8 million is within our control? Can we put a figure on that?
Thank you, Chair. Happy to come in, but our work with health is so integrated with our adult social care that it's not possible to separate it. I don't have a number that I can share because everything we do is in partnership, is internal partnerships within the County Council and our external partnerships as well. They're interwoven.
Thank you, Angie. Thank you, Tandra. Councillor McGough.
Thank you very much, Chair. Just if it's not the right moment for the question, then please just stop me for it, please. There's mention today in the report that Holsworthy Funding Youth Club, sorry, there's mention today in the report that funded the Holsworthy Youth Club being reduced to 0 from 8,000. I was just wondering if you could ask a question about this. This comes from Cottle at the moment. Just wants me to ask this question on behalf, which I don't mind doing so. Could you just explain to us why it's on page 41 on the Integrated Adult Social Care Commissions? Would you just explain that to me, why it's been reduced to 0 from 8,000?
Solveig.
Please.
Thank you. I'm glad you've raised this because I think it's really helpful to explain. So this is in relation to the North Devon Link Centre. And if you notice in the report, the line underneath it shows it's been increased by 8,000. So we weren't funding the youth centre per se, we were funding the provision of the link service within the youth centre building. So we're still going to do that. The difference is we are funding that through the Devon Mental Health Alliance, who will be delivering it all, and that's in with the agreement of the youth centre. So it's the same investment. It's just going to be delivered by a slightly different party. That'll be the same across the whole of the North Devon now. It'll all be delivered through the Devon Mental Health Alliance.
Thank you much. And that leads to another question. Does that also include any changes to the Bideford Link Centre? Is that going to remain open? Obviously, it affects Councillor Julian and myself. Obviously.
So the link service is about the service and what's being delivered, and you'll see the commitment is there to continue funding that service through the Mental Health Alliance.
That's what I wanted to say.
Yeah, and then in terms of the actual buildings, that's a kind of a separate conversation, but there will absolutely be, the services will be delivered in those towns, so there'll be no reduction in service for people wherever it happens to be held. I know there are some conversations about maintenance of the building at the moment, so we're just making sure that that building is safe and warm for people to use. While any maintenance is underway, the service will continue. It'll just be in somewhere else within the town that people are able to access easily. But obviously, we can only use those buildings while they are safe and warm.
Thank you, Chair. Obviously, just for the residents of Bideford and for obviously my area, Northern area, you say that the problem with the building, I'm aware of the problem with the building being in construction. where would the alternative be? Would it be Bideford Library? Would it be an alternative? If so, it gives the Bideford Library another little spruce as well for, and maybe possibly libraries in North and Malappador. Any services get pushed to the east? So obviously we're trying to save you at the moment. Thank you.
Absolutely. So there are already some services covered by the Devon Mental Health Alliance in sort of community places like the libraries. Absolutely. We want to make sure we continue to make use of places that people know, already use and are comfortable with going to. We know that we've had lots of feedback from the service users about how important it is that they feel safe and have dignity and privacy wherever they go. And that's exactly what we're working with them to do. With libraries and other community places. Yes.
You said community places. Good. Are you able to elaborate a little bit more on that?
I haven't got the
precise, or just is it
I
just
haven't got the
generic?
exact detail under my nose, but I'm happy to brief you afterwards, Councillor McGough.
It's okay. Thank you. Thanks, Chair.
Councillor Dawson.
Yeah, I have a question about the upcoming work with Newton and looking at that savings, the savings that need to be made. Of those savings, the part that kind of is directly, hopefully achievable by working with Newton, we know that their track record with other councils has delivered better outcomes for people. Has their track record, and also some savings, has their track record, does it include savings to this level? So could we just hear a bit about that, really? Because we've had assurances about how it's worked before, but specifically relating to budget, what's their track record, please?
Tandra, thank you. Councillor Dawson.
Thank you, Chair. So the first thing Newton did with us was undertake a diagnostic. So they always give you a very honest reflection of what's possible. And you'll see as the figures flow through, there will be this is the part that we think absolutely, and this is the proportion you think is stretch. Every other local authority that was worked with Newton, so if I take Somerset, our nearest neighbour, and I think there is a visit going to happen later, and you'll be able to get it from the horse's mouth, so to speak. But I'm also aware that they've done lots of work in Essex, for example, and Essex have partnered for them for many, many years now because they've been so successful in helping the service improve their outcomes, but also reduce their costs. And there's been lots of partnership working across. So that's absolutely why most councils bring them in. It will be for the big numbers that they need to take, and it's all in proportion, isn't it, into whatever your budget is. So yes.
Thank you. Any more questions? I've got some more questions. I'll go for, Councillor Rogers.
Thank you, Chair. Do the NHS, have they paid back the money they owe Devon?
Angie Sinclair, please.
Thank you, Chair. I'm not sure if the councillor is referring to a particular debt, but the last time I looked at the figures, I think our NHS owed us something around 15 or 17 million pounds, but it's not a historic debt, it's a rolling debt. So it's different debts at different points in time. We're doing quite a lot of work with NHS colleagues at the moment to try and get some of that debt cleared. Most of it is fresh debt, so less than 90 days old. There is some that is older, so over 90 days was something like 3 or 4 million the last time I looked at it. But it is a rolling programme, but we work closely with them. If there's a particular debt you're interested in, then I'm happy to have a look into it for you, Councillor Rogers.
It's just understanding that debt's bearing our purse than the NHS purse adding interest.
I agree entirely. I'd rather have the money in our bank.
And then my second question, Chair. At 17, you're in children's services. At 18, you're an adult. Do we know how many people in Devon? You probably don't know the answer to this question now, but could you come back to understand how many vulnerable people are at the age of 17 going to the age of 18? And are we comfortable and confident we will look out after those individuals going into adult?
Tandra.
So we'll come back with the detail, but we technically start working from the age of 14, and the young people will be confident that we know might be coming to us, our children through the special educational needs where it's a very, we're very clear on what their disability is. Sometimes we might have families moving to the area, and so we won't be able to predict that, but we'll be able to give you some numbers of the people we're working with, and generally we start working with them from the age of 14.
Thank you. Can I ask a question, please? And that's about paragraph 9.4 on page 15. And it relates to the opportunity to make bids, capital bids, from the borrower-funded capital programme. And I believe that the purpose of this is to enable services, and I think children's services have the same opportunity, to make bids for things that will cut costs in the future. So where there are high costs, such as supporting people with complex needs or step down provision or high cost placements, bids can be made. But as we've seen in 9.4, no bids were submitted by adult social care. So I wondered why that was, and would you be making any bids to try and kind of, I suppose, future-proof our services and reduce costs long term?
So we have access to a range of capital and equipment, technology-enabled care through our community equipment service, for example. And there is innovative work already going on. I can't remember the name of the fund that we received, which was direct from government. No, not the disabled, the one that Giles oversees, where we... ARF is, we remember what the acronym is. So we have had separate pots of capital funding to support us, to work with people, to reduce the costs of their care through the use of technology or equipment. If there was a specific project, so for example, if there was a new supported living that was coming on stream, but there isn't currently, but if there was a specific project with a named set of individuals where we could identify it would make a difference, we would absolutely put a bid in for that money. But at the moment, we do have access to capital pots through other ways. And obviously, we're using the flexible use of capital receipts in this transformation programme, and we're going to have 10 million over the next 3 years. So as a service, we are doing things. We just haven't bid on this occasion for this funding, and we'd want to be really clear that it was going to go to a targeted service and what those improvements were going to be.
Do you think going forward that you'll be looking to submit bids?
If there's a project, absolutely. So if extra care housing or supported living, very often with people with complex physical and emotional needs, equipment and technology, or even adaptation of the building, and we might do that as part of working with a housing association in a district, for example.
It seems to me that that would be a really good thing to do to help our residents to build long term, to try and reduce the costs, as well as improve outcomes for people.
But we have a range of people currently living in supported living. We have that as a focused area of work as part of our Newton transformation, so Living Well in Devon. We will be looking at technology as part of that, but we're able to look at other routes to get it. We haven't had to look at this pot of money. So we can think about overnight care, for example, and how we might reduce costs in that area in terms of the number of waking nights, or we can think about an adaptation, but it will be for specific groups of people where we can identify what the physical change might be required. And at the moment, we're able to do it within the access to the funding that we've got. If we think we need more, heads up to Angie, although she might retire by the time we worked out that we need some more, a bid will come through. But we absolutely, I think, anything you can do to improve the environment that somebody lives in, tap into technology in any way, shape or form so that it promotes independence, we're absolutely on board with that. And we are doing it already. We've just used other mechanisms.
Chief Exec.
Yeah, I think we have to be clear that the capital receipts programme, or the flexible use of capital receipts, is under significant stress, and we've made a commitment in children's to £120 million investment over 10 years, so that actually we can keep children and young people in Devon. In terms of the opportunity for further use of flexible capital receipts, it's not a long-term strategy. We're making this investment in Newton as a medium-term strategy to shift that balance to that more enabled. And I think the opportunity for technology in that space, but that shift to prevention is critical. But to think that there's going to be money on a kind of 10-year plan to for the kind of facilities you're talking about, that money's just not there just now. There will be a communication. We've met with group leaders to plan member development day next week, and we are going to have a focus, because many members have asked to understand the link between the capital programme, capital receipts and the assets, or you could call them some liabilities we might have in terms of what we actually have as assets and infrastructure. So we plan to do that at Member Development Day so everybody can understand that complex issue. But really, it's go to the Director of Finance, but it's not a viable long-term option to be looking at that to deliver transformation and change. And actually, as a staff group, separate to the technology, what we're really hoping with the Newton work, that it will help us change the culture such that we don't need those external partners to make change happen at pace, because that money is just not going to be there in the future. And we need to, as a staff group, evolve and change so that actually we can make those changes and do those analytics ourselves. So I'm hoping what the Newton work will do is have an impact across the whole council in terms of how we do our work in the future. Maybe Angie can comment.
Angie, thank you.
Thank you. Again, happy to come in on this one. As the Chief Executive said, flexible use of capital receipts is a great initiative from the government. It does help us to fund transformation. Adult service is in receipt of a lot of that over the medium term. So it's not only the Newton work that you're all familiar with, but of course we have the, as we call it, the JACS project, which is the Joint Adults and Children's System Change. So this is the finance technology change that's ongoing at the moment. That is, again, is all investment within the adult space and is funded from capital receipts through that particular clause in legislation that allows us to fund what would otherwise be a revenue cost through capital. But the approach that Tandra described of using grant first to fund improvements is absolutely the right one. So about 90% broadly of our capital programme is funded through grants and contributions. And I know they come with clauses and nothing in life is free, but at the pointy end of it, effectively, we get that transformation, that change, that investment in our assets effectively free at the point of delivery for us, provided we comply with all those terms and conditions. So 90% of the capital programme across the whole organisation is grants, so with 10% of it being borrowing. As the Chief Executive said, at the moment, all of our capital receipts are being used to fund transformation through the flexible use of capital receipts. That is a short to medium term strategy, so it's predominantly this financial year and next financial year. Those transformation projects then come to a natural end, they taper down. So when you look towards our normal financial planning of 5 years, then we start to build up capital receipts that we can use for more traditional capital projects. So there is more flexibility going forward. Within the pack, you've got some grant funding for disabled facilities grants. So that comes into the county council, is then passported onto our districts. So that is within your service and within your scrutiny today. And page 15 does show the increase over years. When you get to 3031, it's not suddenly we've gone from increasing it from 29 to 10 million. It's because, of course, that's the new 5th year. So that's the total quantum of the grant for that that year. But that is all within your remit to scrutinise today. Thank you, Chair.
Thank you, Angie. Committee, budget questions or comments? Councillor Tilsley.
Thank you very much. The Better Care Fund, could we have a bit more information about what goes into the calculations to what we receive, and does it take into account rural deprivation and our enormous house price to average earnings ratio we have in Devon compared to the country as an average. Thank you.
And whilst you're doing that, I might ask a follow-up question on the Better Care Fund. And the decision to not contribute the 1.5 million top up to the Better Care Fund.
So shall I start with, so that relates to hospital discharge. At the moment, we get a hospital discharge grant. We some time ago negotiated and put an additional 1.45 million in, and our ICB colleagues put some additional money in as well. We've been undertaking some improvement work ahead of launching the Living Well in Devon programme, and have done some targeted review activity. So what that funding does is it extends that pathway. So it's because we can't move people through quickly enough. And what we're saying is that we're making improvements to that pathway, which means we won't have to put that investment in, which is slightly different to the savings that we're going to do as a result of people going into not going into a care home, going home with a smaller package of care. That is specifically investment that we put into the discharge pathway. Discharge pathways, of course, are the responsibility of our NHS partners, but we previously have agreed to top up because we weren't confident about the performance.
What would happen if, say, with winter pressures next year, that money was needed to help with those pathways? What would we do then?
So obviously this is all contingent in everything that Donna said at the start. We all have to work well together. We have to make changes to the way pathways are commissioned, and we have to work more quickly to help people move on to their final destination. If that doesn't work, then we'll obviously end up spending the funding, so that you know, people will not be left without it. But our intention, what we're stating here, is we are making changes that will not require us to put that investment in.
Thank you. Angie.
That's a very good question about the funding formula grant for the Better Care Fund, and it's not changed for many years, and none of us can remember what was in the original formula. So that's a very good question that we'll see if we can find out and get you a written answer to. But as part of the review of government funding that's gone on in the last 12 months, that grant has not formed part of the changes. So all of the changes that you've heard us talk about, Better Care Fund has not been part of that. What is changing? So the funding for next year is the same as the current year, so flat cash effectively. What is changing going forward is that grant will no longer exist as a standalone, which I suspect is why government has not reviewed the formula for it. So it's been rolled into our core funding, the revenue support grant. So this is the last year for 26-27 is the last year it will be a standalone grant. But it's the same formula for many years, just that none of us can remember, sadly, Chair, how that formula was made up. But we will look in, because now we're curious as well. So we will get you a written response to that.
Thank you very much. And just on a follow-up in a similar area, I'm trying to get my head around core spending power and how much of it is based on council tax being set at the government expecting us to set it at 5% and a collection rate of 100%. Do we have any idea of when government will reassess council tax boundaries and whether it will become less of a regressive tax on that, as in looking at how much we can actually take rather than just sticking to these very old council tax bands?
So every year, government decides how much we can increase council tax by. For several years now, that's been effectively 4.99% for the county council. So we have 2% for adult social care, and the remainder is core council tax. Once you've reached the 5%, but once you get to 5%, you then have to hold a referendum to ask if the people of Devon would like to pay 5% or more. And I think we can probably all guess the answer, can't we? So government make that decision every year. They do periodically talk about removing that and changing the system, having houses revalued and so on. But my take, it's probably on the too difficult pile, but I will bring Councillor Buczkowski in just to give the political view as well. But at the moment, the 3-year settlement from government assumes in our core spending power that we will increase by the maximum of 5% each of the 3 years. And which James may come in and say, they also assume we're going to collect 100%, or our districts will collect 100% of that on our behalf. Well, our districts are good, but they're not that good, Chair.
Thank you.
Thank you, Chair. Councillor James Buczkowski, Cabinet Member for Finance. I think the Director of Finance answered the question. But from my perspective, government funding is going down in the later years of the MTFP, and it is being reliant on council tax going up. And council tax is a regressive tax based on house valuations from 1996. It is in desperate need of reform. And the government, we need to call on the government to reform it. It's not within our hands, but they are absolutely pushing the tax burden onto our residents, which is wrong. And the 100% collection rate, it's just not realistic. There is no authority in the country that's collecting 100%. So right from the start, we're being set up to fail. Yeah, it's not good, and we need to be calling on the government to change the council tax system.
Thank you very much. I'd make a recommendation that we do make that call, because it seems, from my point of view, that our hands are entirely tied as to how much council tax goes up by. They've included it in their predictions and calculations, and we've not even technically made the decision yet. That would be my recommendation. Thank you.
Thank you. And I would think we can see on paragraph 4.6, I mean, it's called the fair funding allocation. I mean, that's debatable. But we can see that it goes down, can't we? So the fair funding allocation is what we get from the government, and we can see that 27-28 and then 28-29, it's reducing. So that's going to put increasing pressure on our services, well, on specifically on this service as well. So how is that difficulty and reduction in the money that we get from the government going to be managed within the service, the pressure on our, not just this year, but we can see the reduction next year and the following year?
So we have a 3-year plan. So we're partnering with Newton for 3 years in total. And every year, so we start the work, we've already started the work. We've got the 19.8 for this year, and then in subsequent years, and I can't quote them, but we can bring them at a later date, we will have more reductions. The way that it works, the earlier that you can get in and make the change, the benefit is experienced over a longer period of time. Obviously, what I can't predict is what else is going to go on that might still push costs up further. But at the moment, we've got a plan for what we know.
James, oh, yes.
Thank you, Chair. So obviously, just on that, on the table you pointed out, that is obviously the settlement from the government. Hand in hand with that is the assumption that council tax is going to rise, as we've just discussed. So that's how the government claims that our funding is slightly increasing, is level over the 3 years. It is because of the council tax rather than the support from the government, as we can see. Yeah, just to make that abundantly clear, Chair.
Yeah, thank
for everybody.
you. Oh, Councillor McGough.
Thank you very much, Chair. Excuse me a moment. Reliance on council tax. With central government funding constrained, a high reliance on local council tax means service sustainability is tied to local taxpayers' capacity, which can reduce cost effectiveness if residents feel taxed without proportional service improvements. We keep mentioning we're close partners with Newton. Can we work closely with them to challenge central government through, obviously, the leading administration here? Because this needs to be done, because we can't keep getting less funding from government and not challenging for it. I'm not saying not challenge for it, but can we please challenge for it more? Because the taxpayer of Devon can't always be picking up the shortfall of government. It's putting a huge strain on the taxpayers of Devon, and it's simply not fair. You know, where does the money come from? It comes from us. Ultimately, it comes from taxpayers. So central government, to me, irresponsible anyway. It shouldn't be in there. If they're running a business, it'd be bankrupt. Thank you.
Councillor Buczkowski.
Thank you, Chair. Just to confirm, we are making strong representations to government around the settlement and so-called fair funding. And through our MPs as well, we're engaging with MPs across Devon, making sure that they've got the detail and aware. But I'll certainly look into if there's anything Newton can do to support us with that petition to government.
Thank you. Chief Executive.
It was important to note that in the fair funding review, that for the first time in terms of deprivation in Devon, that there was a significant recognition of that. Some of the analytics we saw is that Devon was previously in that bottom quartile for recognising our challenges and has moved up into top quartile. So I think it's important to note that was recognised, and that was across all the county councils. Also, what was good to see in the budget and the fair funding review is that the remoteness element, and I'm going to the Director of Finance, was retained in adult social care. However, the remoteness element was not retained when fair funding review was working through in the last year. The remoteness element was dropped from children's and areas like highways and public health. So I think there is a nuance here that if that had been retained, and you've got to remember that we don't get anything in the recovery grant either, which has been maintained. So if you look at recovery grant, children's deprivation, poverty, we receive 0, but we've been recognised in a new formula. So there's a number of grants that we have been recognised, but there are others that, in the original work that the Director and the Cabinet Lead carried out in July, we would have been in a much better position if that remoteness had been retained across all services in Devon. So I think it's interesting to note that because we've got our Cabinet Lead for Rural Services, that I think it would be a fantastic push to get that recognition across the board, because some things have positively shifted in the funding formula for us. But other things have been left out, and I don't know, Director of Finance, to what extent we could pull that out, because it was significant funding changes at the last minute, and we're still trying to unpack some of that, so it's quite difficult for yourselves in terms of lobbying at the moment. And in case anyone's listening, we are still concerned that there's been a lot in the media about the recovery grant. There's been a lot of lobbying in certain areas, and I'm still concerned today that that final settlement might change in the next few weeks. I'm really concerned because there have been so many changes over the last 6 to 8 months, but perhaps the Director could clarify that.
Thank you.
Thank you.
So we received our provisional finance settlement, Devon and the whole of local government, just before Christmas. We'd hoped that it was coming sooner, but it was in fact just before Christmas. As we've said, the good news is that it's a 3-year settlement. In recent years, we've only had 1 year at a time. Although our planning horizon is always 5 years, government has stuck rigidly to 1 year at a time, which is really hinders what we're trying to achieve. That provisional settlement is then subject to consultation. So and then normally we would receive the final local government settlement, normally 2nd, 3rd, 4th, maybe of February, something like that. We just heard at the end of last week that all indications are that that final settlement won't be coming until the 9th of February. So that is significant delay for local government, because we have a statutory duty to set our budget by the end of February, to allow our districts to then set theirs, including the council tax, so that the billing can take place. So we need to have the budget complete by the end of February. We're not going to hear what our final figures are until the 9th, possibly. In years gone by, that's maybe not been such an issue, because typically the final settlement will only change by maybe 20,000-25,000. It's minor. So on a budget like us of 2 billion turnover a year, it's not even roundings for us. However, I think there's a greater risk this year. There's a lot of noise, as the Chief Executive says, in local government press around those in receipt of the recovery grant not being happy with the reduction over that 3-year period of that recovery grant. We got 0 from the outset, so have perhaps a little less sympathy than some who are receiving it. But because of that level of noise and the rest of the political noise nationally, I'm not certain that our settlement won't change. So I think there's a high risk that the provisional settlement won't hold, that we may have different 3-year funding figures come the 9th or 10th of February. I hope not, but because it's very late in the day for us to be remodelling a whole medium-term financial plan. But I think there is a high risk. We're also, of course, and although it's not your committee, but it is important context, we're waiting for the government's plans for special educational needs and disability, what the government is going to do with the cumulative deficit that we're holding. And of course, that impacts on the risk of every budget that we're setting. So we're waiting for that announcement. That also was planned for last summer, was then delayed to the autumn. We were then told it was coming as part of the provisional settlement at Christmas. It didn't arrive. We're now being told it's coming as part of the final settlement. So we're waiting for a lot. And of course, we're still waiting for the SEND white paper as well, which is more about the practice of delivering that service. So there's a lot of uncertainty at the moment. So ordinarily, I'm sitting here saying these budgets will hold to you. I can't guarantee that this time because of the risk of that funding changing significantly.
Thank you very much. Ooh, Councillor, so we've got Councillor Hodson, Councillor Julian was first, Councillor Hodson, Councillor Abbott. Councillor Julian, please.
Yes, thank you very much. After that statement you've just made, I mean, are these budgets then can't be written in stone now, so the things are going to change, so we can have cuts now, can't we? It's possible that we could have cuts if central government are not going to honour a lot of what you've set out. It seems that making us all very nervous, isn't it? Because we could be in a very precarious position. If you could sort of let me know if that is the case, because we're sitting here with a budget and it might not be the budget. Thank you.
Thank you, Chair. Councillor James Kowski, Cabinet Member for Finance. Absolutely. The uncertainty that we have at the moment is unheard of. You know, we have not experienced this before. It's my first time at County Council, but at District have experience. Obviously, we've got a huge amount of experience in the team. This is unheard of what government is doing and pushing it right back. So obviously the budget that's in front of you today are with the figures that we've been given on the provisional settlement, and we hope that will hold. If it changes on the 9th of February, then I think there's going to be a lot of late nights to change that and bring something back that fits in within our settlement. I'm hopeful that the government won't change it, but who knows? I'm not going to make it overly political, but this government has been seen to be making some very odd decisions recently. So I'm hopeful it won't change.
Thank you, Councillor Bukowski. Councillor Hodson.
Parliamentary. Thank you. So are we, with that statement, are we going to come back then and have another discussion if it's bad news to discuss where we're going to go with all the budgets? Because we can't leave this just in the mid-air, can we? Thank you.
You Chair. Timings I don't think will allow. So we're really, really close on the wire already for Cabinet and full council. So it will be full council ultimate make the decision in any event, but there definitely will not be time to do another round of scrutiny.
Thanks. Just to be clear on that, obviously it's been scrutinised today. We pick up the points that will go to Cabinet and then on to full council. So it is full council that makes the final decision. So all members will get the opportunity to contribute. So it's not a case of that there won't be any scrutiny or on contributions from members. It's a full council decision. So there is that at the end of the process. So rest assured, if it does change considerably, you will have the opportunity to comment and be involved.
Thank you.
We are planning to communicate to members this afternoon. We only heard on Friday that the settlement might not be coming on the 2nd. We're just checking through various government channels. We do have a reserve date for the council. It's my understanding the reserve date has never been needed in 18 years in this council. So I think it evidences to you that concern that this is unprecedented in terms of not having the final settlement on time. But there is a reserve date, and I do plan to communicate to members later in terms of possible changes to Cabinet and Council once we just get that confirmation of what we heard through the networks that our director is involved on. We only heard that on Friday.
Thank you. Councillor Hodson.
Thank you. I'm going back a little way in our conversation. I've been waiting for my turn. Relating to the Chief Exec's comments about the recovery grant. I was concerned that, we have not been allocated. We hear that the recognition of our areas of deprivation has increased. However, there seems to be a little contradiction here. How can we have areas of deprivation across Devon and not have any acknowledgement of the need for this kind of funding? So I think we ought to be, as a committee, challenging that, because if you're not allocating it to district authorities and funding in their RSG under the Fair Funding Review, it's got to go somewhere. And I think you've said that some authorities are actually challenging this particular grant. I think we should be joining forces with them, because we do have extreme pockets of deprivation across Devon, and this needs to be recognised. Thank you.
Absolutely, and I think particularly if that remoteness indicator had been allocated across the board to services in Devon, then the Fairer Funding Review would be recognising that, because the recovery grant will stop and was put in place as a transitional element. But the fact that our deprivation's been recognised, but our remoteness has not. And it's that bit about we all know to deliver services across Devon, particularly in adult social care, which has been recognised, but it hits every service area in terms of access costs or on costs, or even, I suppose, in terms of commissioning or contracting, it's more expensive. So I would absolutely agree it's a concern, and particularly what the Director of Public Health has said. I mean, I have been involved in meetings the last few years where we've always made that pitch for that public health grant. But when you look at a lot of the statistics that the Director of Public Health has, where we are outliers in terms of a number of areas, you just look at something like domestic abuse, for example, and delivering support services, it just does not seem right that we are not getting that remoteness allocation or that review of the public health grant considered. I mean, what we heard earlier is quite shocking, is that in a rural area we're in that bottom quartile for funding and no recognition at all. And that's why I mentioned the NHS earlier, in that I do genuinely, when I look at the scale of savings expected for the NHS in Devon, I think it's unreasonable for the level of savings. So I say it not just as Devon local government, but as Devon partners, that it's a significant scale when you put it together.
Thank you for that. I quite agree with you. The other element is the lack of recognition for rurality and the challenges facing rural authorities in delivering services and the additional costs. And I'd like to support any challenge that we make in that being removed as a consideration in the Fair Funding Review. And I think we ought to challenge that vigorously, because it will impact on, you look at the size of Devon and you look at just the road structures, everything, to have no acknowledgement of that is, I would say, neglectful at best, criminal at worst. Thank you.
Thank you, Councillor Hodson. And what it seems to be the case is that the remoteness is recognised in some services, but not in others. That's completely unbelievable and inconsistent. And I think we should be making representations. This committee, I think, certainly for public health, but are you saying that it's taken into account for adult social care? But certainly for public health, it sounds as though it's not, in which case we should make representations about that.
Thank you. So the remoteness or rurality element, we were very vocal, very robust in our response to the initial plans of government that were published last summer. We, along with other rural authorities, and lots of examples were given around the extra cost of delivering, and they were only examples, and it was adult social care that was used as the example. by us and by other bodies like the LGA, Society of County Treasurers and so on. Government chose to use those examples as us saying that's the only factor, the only service that's impacted, but of course it isn't. They were just examples. So I think it is policy intent. So the rurality, remoteness was reinstated or held within adults and then removed from every other grant that was subject to the fair funding review. Public health isn't linked to cost of delivering services at all. So the public health grant is, I know Steve has gone now, but public health grant is linked to spend when public health was part of the health service. So when public health moved from NHS across to local government, the way they assessed the funding was looking at how much that NHS area had spent on public health. And at that point, the Devon County footprint had not spent very much, so we didn't receive very much, whereas Torbay and Plymouth's health areas had spent more, so they received more. And since then, the formula has not been revisited, so we get the same as historically. That was what was spent in Devon, and it's not fair.
I mean,
it's
you
not
just
right.
couldn't
But
make, I mean, that's just unbelievable, isn't it? That some random
Absolutely.
spending a long time ago
20
is the
years ago.
basis
Yeah.
for public health spending on our residents today.
Yeah, I think it was maybe 15, 16 years ago that public health transferred from NHS to us, and it's still the same formula.
Thank you. I think we've got Councillor Abbott and then Councillor Ketchum, please.
Thank you. To go right back to the question from Councillor McGough and the way that the finances are projected, I guess you do look 5 years and 10 years ahead, but and you're doing it on best estimates. How well does that work out in reality, and what adjustments have to be made? And so it's not really about the uncertainty now. It's about that long-term planning.
So yeah, we try to look 5 years into the future, but of course, even predicting what's going to happen next year is full of risk and uncertainty. Hence the whole section on risk and what we might do to mitigate. So as you get to year 2, 3, 4, and 5, we try and estimate based on government policy expectations around inflation. We're trying to look at individual service pressures. We're trying to even looking at national living wage that has a significant impact on the adults budget, trying to estimate what government policy. Different governments come and go over that period, so it is inherently risky, but it's still good practice for us to estimate those 5 years as we can. It's an annual refresh of those 5 years. Some years we're more accurate than others. The change in the national political setup has made the risk and uncertainty greater at the moment than we've seen perhaps in years gone by. But we work within that. We have a very strong risk management approach. So collectively across the organisation, we're always looking at our risks, refreshing them, trying to come up with mitigations. But of course, we don't live in isolation. So we refresh as much as we can.
So, thank you. I guess, therefore, you would be able to make an estimate on how that estimation process in previous years has worked out, and then it might give confidence about moving forward, even though it includes uncertainty. I'd like to ask a second question, please. We've been asking for points of clarification on your report, but the expertise rests with you, and I wonder, are there things that we're missing? What would you say are the issues for scrutiny purposes that that should be brought out that we're not seeing because we're not the experts? And that's asking for a collegiate approach, but you are, and you are the experts, and I feel very much on the edge. I can tell you about maps, but not so much about finance of health.
Thank you, Councillor Abbott.
So I think you are picking up on the right things. We try and lead you a bit by the covering report. So we've tried to set out what the assumptions are. We've got a section on the risks that we're facing. We're very open, we're very transparent, and we try to write it in plain English, but recognising what Councillor McGough said, it is inherently difficult, but we do our best. I think probably national living wage you've not picked up on, and that's a key risk certainly for this service, more so than our other services. Even children's services are not as impacted as this service by national living wage. So I think that's probably the only one that springs to my mind that we've not touched upon yet.
I was only going to add a bit of a plug for Peter. So you've had a briefing from Peter Hay, and I thought that was really helpful in terms of lifting up. So absolutely agree with Angie. I think we are trying to guide you as best we can. I think it is difficult sometimes as officers. We're so used to the shorthand and sort of moving away from that and not using the acronyms and maybe explaining things in more sort of lay public terms, but the report that Peter's provided actually guides you quite well in terms of the areas that questions you might want to ask of the service and a finance colleague.
Thank you, and I'd like to maybe now be a perfect time to bring in Peter Hay to say whether to comment on anything that you've heard today or to draw anything out particularly from your report. And I think one thing that we haven't touched on yet is the voluntary and community sector. So the kind of quite narrow scheme of grants in that section of the report, and what your views are on that, as well as more widely on the budget. Thank you.
Well, thank you. And thank you for the opportunity of being back at a more normal council. The Department of Health and Social Care improvement work means that I'm seeing some budget processes which look very different. I think we'll draw a veil there. Underneath that is a hidden compliment. I don't give compliments very easily about the way in which you've approached this, because I think you have a very strong model. And equally, I think one of the things that can give you a lot of confidence is that, as well as discussion which sees a kind of an approach to how you're going to release cash, you're also putting investment into some areas. So you've reviewed the totality and you've got ups and downs, if that makes sense. And I think that's always a good sign for elected members to look at, that you can see that sort of comprehensive review. It is tricky. I think you've hit the nail on the head there, Councillor Abbott, because there's an awful, as I put in the briefing note, there's a lot of moving parts in an approach which links the budget to the service model. But then actually the budget really should be an articulation in numbers of your plan. That makes sense. So if you think of those two things as being synonymous rather than different, and they are working for you, because for the last 3 years, as I've charted very highly, you've stuck with the budget, and you're not in a position where you've seen overspends or carry forwards and all the other shenanigans that are going on. So you're in quite a strong position going forward. You're now seeking, I think, to take that further in the work with Newton. I think there are two areas in your model which I think has served you well, and the strengths-based, and in particular the way you've linked strengths-based to enablement, I think is a real credit to Devon, and you've done very well on that. But if you look at taking that model further, I think the weakest part of it here in Devon is your link into the voluntary and community sector and the kind of neighbourhood health things that are beginning to emerge. So I think neighbourhood health gives you an opportunity to rethink that. And I think I've been quite blunt. You've clearly got, you're seeing here what you've, I mean, I know you've questioned it, but the spend to the VCSE is a historic grant allocation, basically, rather than thinking about how tactically and strategically you might want to use those neighbourhoods. And I think the other bit is a bit of a flip side to the deprivation issue, is that adult social care, where government has, I think it would be fair to say, it's made a conscious choice to not reform adult social care. But then equally, the LGA twice has refused to implement DILNOT, which is on the statute book. So as an independent advisor, I can quite happily cast a plague on both of your houses. But the implications of that are that adult social care for older people is being self-funded. and is also going to grow in the areas where money exists, because the driver of the market isn't council funding, it is self-funding. So all of you living in more affluent areas will see new care homes going up, etc. And they're targeting that. So I think you've got to think about how you can apply this model to your whole population. That's you living well in Devon. And in particular, how you might want to offset some of the demands you're seeing from people who run out of money because they've been in care homes for a long time. And it's a bit of a cameo, but I did throw something at the television the other night, which is very rare in my household, I promise, because they were showing somebody playing, a group of people playing traitors in a care home. Well, council funded people are not in a state where they're playing traitors in a care setting. Their level of need, the level of dementia or their frailty is significantly more advanced with that. And that's the risk that you're running of how early people are burning up resource, if that makes sense. So I think something about how you think about extending that model as elected members into communities and into self-funders. You've then got a set of risks. Health is obviously one of them. Housing underneath that, which is, I think, acknowledged in your work you've done around local government reorganisation. But again, that housing issues kind of sit underneath that. I think you've got a long-term problem in the workforce that kind of keeps popping up. How to get a workforce in a rural, ageing county is a really significant challenge. And also, I thought it was a very interesting one this morning in the remarks from Newton about the culture. One of the things I think the directorate have done really, really well is to take the staff with them. I know you hold Chandra accountable for all the spend, but actually she doesn't spend very much of it at all. She, she takes responsibility for what the social work side, the professional activity. And I think one of the things you've done is really bind professional activity into this process. But it's a real knife edge, if that makes sense, that you reach a point that's a tipping point between it being professional or finance. It's nice to keep it tense, but you've got to keep it on that right side. And again, just to categorize it and very broadly, there's a real difference between a social worker who turns up and says, well, I would do this, but the director tells me I haven't got the money. And the social worker who turns up and says, I know you're thinking about residential care, but we could do this. And this is how I make your life at home happen. You see what I mean? And it's, if you can, so I think making sure you stay on the right side of that thin edge, if that makes sense, that you keep that link with the staffing and you've got that buy-in is really important. And the final piece I'd say really is I think there's also something, and we're just, one of the things we were doing is there's something about how you position yourself in here, I think, really critically in relation to the NHS. But actually, are there things where you want to be, I think the sporting term is want to move your press forward. Do you want to actually start to say, I know there's a lot of risk around here, but are we prepared to press harder for the things we want? It's a bit unfair with Steve not being in the room, but the transformational objective was youth centres and libraries, which is council side. Do you want to take that further and say, if we did this across neighbourhoods, including the NHS, and push hard, that makes sense? Are there things there that you can start to think about? But because I think what I've said very strongly in the briefing notes is, I think your risks are more in years 2s and 3s of this settlement, if that makes sense, particularly when you put that across all the NHS sides. And I thought what Angie said finally was just really interesting. Your public health spend is based on your historic spend in a system which is prioritising the acute, not the preventative. And your budget is formulated the other way around, if that makes sense. So I think there's something in that joint space that is really important to pay attention to, because it's clearly there as a historic weakness and may catch you in the present. And that's hence the point about the present. Sorry, I'm not intending to rabbit on or take over, but I hope that's helpful in kind of giving you the sort of picture. And I think, Councillor Bad, you can take quite a lot of confidence from that, but equally I think the team are very open to how do we share these moving parts with you and give you that ongoing confidence in this kind of area.
Thank you very much, Peter. Very helpful. I think Councillor Ketchin had his hand up previously.
think the debate's moved on a bit since then, so it's fine. I'll just say that.
Members, any comments, concerns, questions? Oh, Councillor June and then Councillor Tilsley.
Yes, I think you highlighted that rather well, that affluent areas will have places where they can homes for the elderly, you know, but North Devon, we haven't got this. You know, this is a big separation here. We don't have the money like the affluent areas. So what are we going to do? Because this is being, as we've had committee with had adult social care committee, you know, this is a big expenditure, isn't it? Because there is a big divide, and it's so sad that we've got the north and the south, and we've got to sort this out. We really have, Chair. So what can we do to sort it out money wise? Thank you.
No, I think you're spot on. That's the other implication of this, that if you're supply is going down in the more disadvantaged areas. So when Tandra and the social workers turn up to buy council-based care, you often can't find it in those other areas, or if you can, it's either not in that area, so you're asking people to move away from their neighbourhood, or you're being asked to pay at the self-funding rate. And that's the implications of the self-funding. It's not true of Devon, but there are other councils where they now do not pay a market rate because the market tells them what it's going to pay. So the market says, we're set up here to provide £1,500 a week care, well above the fair fee rate, I should say, and we're going to charge you that if you want that bed. So you're absolutely right to highlight the implications, if you like, very crudely on a north-south basis. But I think at the centre of that is the person who then finds they can't get care in the neighbourhood where they've lived all their lives at the end of their life. Makes sense.
Thank you. And that really hits the nail on the head here. We've got to pay to keep our carers here, to keep the residents here, and that is where it is. If we don't pay, then people have to be moved out the area, and that's not what we're about. We're about to try and keep, you know, everybody together in the area, in Devon, and look after everybody. And if we don't pay, it's going to go and fall to pieces. You're absolutely right there. So if we can sort something out, and that's all in the budget, you know, we've got to try and sort something out here, because or else we're going to be doomed. Thank you.
Thank you, Councillor Julian. Tandra.
So I suppose I absolutely agree with Peter, but I would say that the market in Devon is quite stable. We've got a lot of small and medium enterprise homes. Because of the way that we are organised, we can use the adult social care budget based on the total income that we get in order to support people and how we work with providers. Obviously, in a new world with local government reform, that will change, and some of the concerns that you're expressing will be materialised because it will be based on the income of that local area. That's not to say that there aren't pressures. So what I'm seeing all the time is, I think you said burning through their cash. Absolutely. So what we need to do is be strengths-based and work with people to help them avoid going into care homes playing traitors. Not that I'm against them playing traitors, but they could do it in a local community centre or whatever, and be in their own home with minimal care. That will help them spend their money more wisely, and obviously be a better outcome for them. So there are challenges coming down the road. We haven't mentioned it today. Fair pay agreement will be coming in 27-28. That will be on top of the national living wage. So at a national level, there will be an adult social care negotiating body that councils aren't currently going to be represented on, and they will determine a figure specifically for the adult social care independent workforce. That's what we're pushing it for, because the low pay is so challenging there. That will push costs coming through. I also mentioned as well that we've got an older person's fee model. We use that to negotiate with our care homes, and that should help us maintain the stable market. And also Devon has a track record of paying well. So if you compare us to other areas, we made a long-term commitment, the council did, long before I arrived here, to pay at the national living wage level, but also to invest enough in the fee that they can take sort of training and development, etc. So we've got quite a strong market here. There are other places in the country. So where I worked previously, for example, in Southend, if you look at their benchmarking information, a very low payer. So, you know, we do all right in Devon, but that's not to say that the risks that Peter has highlighted aren't a concern and that we shouldn't be doing everything that we can to continue to manage them.
Thank you, Tanja. I think the Chief Executive wanted to come in.
Councillor Abbott and Councillor Julian have led to, I think, the importance of quantifying some very specific risks. And I know that Councillor McGuff said, let's not discuss LGR, but what you've just said, Councillor Julian, about needs, we carried out an assessment for local government reorganisation based on needs rather than just cost per head of the population. Many of the proposals that have been produced do not do that. Now, we will have an opportunity during the consultation to submit that, but if you're asking about a medium and a longer term, it is the view of the officers in the room that some of the models that have been put forward for local government reorganisation in Devon will automatically, instantly put some of those new councils into section 114. Financially not viable on day one. Now we will submit that through local government reorganisation because Councillor Julian, what we can do at the moment every day in all people services in Devon with the scale of the budget we have is that we prioritise needs and we fund needs at the highest level. It's not possible to do that by just looking at the population, and every opportunity you take to reduce the scale of that budget envelope, then there will be places in Devon that would not be able to fund adult social care or show the agility or the mobility to get staff or resource across locality teams based on that need. So we currently have that ability to do in the people services, and we're quite happy to share that analysis that evidences that. So I do think it's something based on your question about, you know, looking ahead, what are the risks? The other bit linked to that is the scale of this transformation. It is a 3-year programme, and the current timelines for LGR would disrupt that in terms of setting up shadow authorities and so on. That's a huge risk. I think the other thing that is important, and Director of Finance mentioned it earlier, we don't know what's happening with the SEND deficit today. We don't know. And what I see every single week is Tanja and the team working with children's services with those young people with real complexities and that, you know, our kind of working age adults population. Those SEND reforms are critical to, again, a bit like we're trying to do in adults, is to making sure that we can get the right package around our young people in initially schools and learning communities close to home. And so we heard last week, just joining the committees and the Children's Scrutiny Committee, a real concern about the funding for schools in Devon. We've not mentioned it today, but one of the reasons that our very dedicated school practitioners and colleagues are unable to keep young people in the community is because the schools in Devon for many, many years have been really poorly funded. So schools can't afford to have support assistance for the most vulnerable young people. So I think you have to join the dots, because we know that those young people come into transitions and adult services, and if they are not in Devon, or if they are in placements out with their community, and the costs are going to be greater, whether it's transport, whether it's getting the support or the supervision, or the social worker to those young adults to make sure that they're okay. So we cannot underestimate that not knowing what's happening with the SEND white paper and what is actually going to happen at local level to shift the system, then all the good work that we're doing in adults transformation won't even touch the sides of the flow that's going to come through in terms of our young people who are really struggling to thrive in their local communities.
Thank you. Vice Chair.
Thank you, Chair. I wanted to go back just to talk about trying to keep people at home for longer, to keep them more able before going into ruinously expensive care and the self-funding inevitably running out. And please excuse the anecdotal evidence, but we met with occupational therapists in North Devon the other day. They have as many occupational therapists level grade 6 as they have vacancies. and the occupational therapists they have spend more of their time driving between Bude and Minehead and all of North Devon than they actually do looking after people. And I hope they don't mind me saying that they're closer to retirement than they are qualifying. The risk to our elderly people of not being kept at home seems to be hinging on our workforce massively, especially at that really sharp end with people like occupational therapists. In this budget and in Newton's predictions, how are we making sure that that workforce really does deliver and really does like stay sustainable and not end up with us costing huge amounts of money in personal care much quicker than it needs to be? Thank you.
Tanja.
Well, I'll come in first, and then I'm going to bring in Amy because she's actually an occupational therapist and she might implode if she doesn't get to talk on this point. So what I would say is absolutely, it's a national issue, getting enough occupational therapists. And so we will keep pushing forward, and Amy will talk about that. In terms of the Newton work, that's about the culture of the entire staff and how we all work with the people out there. So occupational therapists, hugely important. Equally as important as social workers, social care assessors, commissioners, that we all need to be going out there with consistent messaging. But if you even take it into the hospital, it's equally important what in that discharge hub, what those clinical staff are saying. And in the hierarchy, if a clinician says something, then I think it's probably going to carry more weight in many respects. So that joint working that we do will be built in to the Newton work, and are sort of going along in the same direction, and that will be that's integral to all of that delivery, which is about promoting independence. And coming back to the earlier question, about capital funding, it's about technology enabled care, it's about working with the districts around adapting homes. There's many different factors that might come into play when you're trying to work with an individual, not least what Peter said. If a social worker or whoever goes out and says, because the director said, then that isn't going to land very well. But if they say, actually, there's a better option and they can work with them on that basis, that's going to be, obviously put us in a stronger position. But I'm going to hand over to Amy.
Thank you. Yeah, I think you visited our Care Direct Plus centre in the north. So I know that there's a couple of specific posts in there where we've promoted the occupational therapists to the band 6. So I think there's some active live vacancies at the moment. So that's certainly something that we're always regularly supporting, ensuring that we move forward and get those recruited as soon as possible. I think obviously I'm biased because I'm an occupational therapist, but there's a bit about the transformation programme we're already talking about is really thinking about how we do the business of the work that we need to do in adult social care. And so some of that is about going back to Peter Hay in terms of working with our local communities, because there's an opportunity for us to do things more creatively in how we support occupational therapy activities. So better use of local clinics, one therapist driving to a community location that's well accessible. We talked about libraries, we talked about other opportunities in communities to try and move our model on from a traditional model where we're out visiting length and breadth of the county on individual visits, and thinking about how we can mobilise that therapy resource in a smarter, more agile way, and how we can draw upon some of the other improvements like our better operating system and better use of technology-enabled care and better use of more upskilling other parts of the workforce and our local community volunteers and our providers around that low-level support that sometimes has been reliant on a professionally qualified occupational therapist, when actually a professionally qualified occupational therapist upskilling, training and supporting our community and our partners can create better efficiency for that as well. So it's about being able to get more therapy opportunities across the community. So prevention is the key here, and one of the largest parts of the transformation programme is about that shift from reactive provision in adult social care to prevention, and occupational therapists, that's part of their core philosophy and rooted in all they do. So really focusing that shift over to prevention across the coming years, I think will help us better support managing the workforce that we've got.
Thank you. Thank you very much. It really draws attention to my second question, which is very similar. Prevention. How do we measure prevention savings? Because an awful lot of occupational therapists work, just as an example, saves the NHS money. I think the example was given to us, if we don't spend £8,000 on an accessible bath, it might cost £80,000 on a hip replacement, but that's on the NHS's budget. rather than ours. And then my second point, but thank you, Tundra, sorry.
Potentially it could cost the NHS funding for an intervention, but it will also cost adult social care because that person's going to need help. And where our costs are, which is why national living wage is such an implication, is I think about 90% of what we do is commissioned through the external market. So it's about people going and caring, whether that's in a care home setting or in their own home. So it would have a cost implication for us.
Absolutely. So I didn't mean to disparage them. I'm just worried about the savings in general, because the NHS and us are racing to make those savings. But yeah, I completely agree that it will have a cost implication if we don't invest now. I'm just making sure that we are having those conversations about those savings. I've run into a bit of my own point there. Sorry.
We will have a more detailed discussion because I think there's a report later from Newton, but it was written in December. And because of the timing of submitting the report, it doesn't have as much information as we would like you to have. So we can give you more, but just to provide you with some reassurance that they have worked through. So they've had best outcomes workshops, which have been attended by a range of staff. They've looked at specific cases and what the outcome for that individual was. And if it wasn't the best outcome, if the best outcome had occurred, what difference would that make, both in terms of the long term for that individual, because ultimately we're here for people, but also in terms of cost. And that's how you get that number. We just won't be spending that funding because we can look at what the cost of the different better outcome would be in the context of what we're currently paying for them where we didn't get the best outcome for that person. Is that helpful? So it will be concrete numbers, which is what I'm trying to say.
Thank you. I think you got to my point better than I did. So thank you.
Thank you. So I think if maybe we're now almost ready to move on to discuss some recommendations from this committee to Cabinet. I've just got, oh, sorry, Dermot's got, Councillor McGough's got a question, and I've got one more question. So my question is in relation to page 45 and the risk assessment. So my question, there's a sentence in the third column, and it says risk of loss of full year effect due to lengthy consultation requirements delaying implementation. So this is social care workforce. Sorry, this is savings, alternatives, sources of funding and additional income. And I just wasn't sure where it says on page 45, risk of loss of full year effect due to lengthy consultation requirements delaying implementation, what that's referring to. Are there any service like cuts proposed? I just want to double check that they're not. Thank you.
So this is where I make a confession. So in the drive to get these papers ready, we ran out of time to do a detailed piece of work on the risk assessment. We were hoping you wouldn't get to it today, but obviously you have, and that relates to a previous year. So what we need to do is we need to go through these risks and restate them, but we didn't do the detailed work. So right now we don't have a specific piece of work within Living Well in Devon or the additional that we're doing that requires a staff restructure that would be delayed by a consultation. And there's nothing that we are doing that requires consultation in that formal way. Whereas in previous years, we have had things in place where we're reducing staffing, where you would have had to do an HR consultation, but we don't have that planned as it stands.
Thank you. So how much of the risk assessment, is it just that sentence or is it
So I think
all of the risk assessment?
It's not all of the risk assessments. So some of the risks stand because they're long standing, but there's some nuances that we would like to go background, like that one that you've just highlighted, and bring it up to date with what we're doing in the next year.
So can I go to the monitoring officer, please, and just check how we deal with if the risk assessment isn't
I was going to
entirely.
say on that particular point, I'd strike through. I'm quite happy to amend the record on that, remove it. That would be my recommendation to you. So if it's not correct, if it's inaccurate, let's remove that and put in the minute that that's removed and it's inaccurate on that
But
one.
are there other parts that need to be removed?
Yeah,
I don't think there are.
myself and the Director of Finance went through this word by word, line by line. That's just clearly, but if we've missed that, but everything is down there unless anybody points out to today, we absolutely signed off. I think though after scrutiny, we revisit this based on your comments, so there may be additional, just as we've said earlier, that we put in, but I'm confident that they're very current and based on what we're doing. I think the bit in terms of Newton, we are getting that kind of weekly analytics and diagnostics back from the external team and the internal team. So right up to that preparation of budget papers, will we do the most up-to-date kind of analytics on that?
Thank you. I think.
Sorry, it's just because obviously the minutes are down to me. Can I get some clarity on exactly what's being stricken? Or is it just that line about the risk of loss of full-year effect? Just that line. I think the chief exec for the water bottle. Nothing personal, Donna. Yeah, so just the line that says risk of loss of full-year effect, just that line. Okay. That's fine. Obviously, if there is anything, I'll deal with that after the meeting, but that's fine. Thank you.
We think there's some confusion in the way it's been expressed. It doesn't relate to workforce changes. So we'll go back. If it's confusing, then I think we probably need to either just take it out completely. That might be the simplest thing, just so as not to hold anything up. But it's not. So it's obviously led you to draw the wrong conclusion. So we need to think about how we express it, but we'll just take it out in this instance.
Thank you. I think Councillor McGough has got a question, so apologies, I went first.
No apologies needed, Chair. You're the Chair. You're in charge. As we raise the local government reorganisation, I'll do my question over again then. So we've got additional funding of 33.2 million, which we've taken into account including national living wage. Have we also included the pension scheme going forward and the possibility of voluntary redundancies of the officers leaving the authority? You know, what impact would that have in our budget going forward? Or is there a ring-fenced figure for this, please? Because you know it's going to be major in the end. So have we kind of projected it going forward?
Director of Finance, please.
Thank you, Chair. Currently, the medium-term financial plan does not include local government reorganisation. The uncertainties are too great at the moment. So although the proposals are with government, the government has not yet even announced which options it will consult on. We have no timeframes. It's sort of too up in the air. So at the moment, we're carrying on business as usual in our medium-term financial plan. If and when things change and we have some certainty or some indication, direction of travel, then the medium-term financial plan will be updated at that point.
Yeah, thank you very much for that. Now, obviously, I kind of understand that where it's going. With HR implications, then, how many officers? I don't need to know names of officers, but how many officers come forward with uncertainty, saying that, you know, I'm near the end of my term. Do I get voluntary insolvency? What impact has that had on the authority itself? Or you can't answer that question. If you can't, it's not a problem.
It's just too early. We're not at that position yet. Where I don't know if Director of People and Culture wants to come in, but we're not yet at the point where those conversations are happening. It's just too uncertain. No.
Yeah, I think it's important to say that you know, we've got staff briefings next week, and my message for 2026 is, you know, improvement, and you know, we'll deal with LGR when it comes along, but our focus is delivering the strategic plan, keeping on track with the budget, on improving the services for the residents of Devon. As the Director of Finance has said, that you know, there's not anything in that national programme that has met any of the timescales set to date. So, you know, the devolution, Surrey first and LGR was slightly delayed. We've not really got a sense of the next set that are ahead of Devon, whether they'll be on track or not. We are working closely as 11 councils in Devon and are getting together shortly with national advisors to start doing preparatory work, but I don't see it impacting what we will be doing in 2026. And that's certainly the message that, you know, I would want the residents of Devon to hear, and also for staff to hear that we need to focus on doing our best job. Maria will be leading on some of the transition work as the Director of People and Culture. So you might want to just outline the kind of preparation work we'll carry out in 2026.
Thank you, Chief Executive. So just in terms of staff and where people's heads are at, we've kind of been sense checking with staff throughout the process. So I would say probably 6 months ago, people were less kind of concerned on that. We've just done the people survey for 2025. There's definitely an increased number of people paying active attention to what's happening in relation to LGR. So so nearly 80% have said that they're actively paying attention to what's happening now, whereas they hadn't been previously. So where we do regular change and resilience courses, it hadn't been featuring as an area of concern, and it's starting to play into that a little bit more. In terms of things that we're focusing on at the moment, it's making sure our own house is in order. So an audit of all of our terms and conditions, all of the contracts people have, all of that sort of thing, because actually there's a huge amount of staff involved in this, whatever option finally takes place. So it's making sure all of that activity is undertaken at the moment. So that's what we were looking at from an LGR perspective.
Thank you very much. So I don't know whether we've got any, is it a specific budget question?
May I just come back
Yeah.
to that point that was raised, please? The reason why I raised this is obviously I've had members of staff come to me personally and asked me to raise it on their behalf, because they are concerned for their jobs, and quite rightly so. And you know, very pleased that you're already doing this. You know, it was really good to know. Obviously, my job as councillor is to look after residents and members of staff, because you're residents to us anyway. And this is the platform for me to be able to air this on their behalf. So I'm grateful for the opportunity. Can I just say, going with budget, you know, the LGR said about the new Devon, one Devon, what it's, you know, this is Devon. We are Devon, okay? So what we're doing at the moment, carry on as normal, I think is the only way you can do it. But the huge resources it's taken off our senior staff's time and junior members of staff time, the resources where I'm saying you're all tied up in this LGR, which quite rightly so, you have no choice. You're being forced on by central government here. But that's costing us taxpayers, costing us a lot of money for the senior members of staff to have to work on this on our behalf, which you need to. But you already reduced the pay before us in the LGR, and that cost us, I think that was £250,000 taxpayers' money as well, with the document that had to be right. So, you know, I know you outsource some of it, which is quite rightly so. We need an independent view on it. So, you know, make sure we transparency for the public. You've done that. I personally didn't agree with the amount of figure going on it, because we got such a great team in front of us now, senior team here, but I understand the transparency and the neutrality that you needed from this. So that's why you outsource some of the work there, which is, unfortunately, we've got to suck it and see. But, you know, this Devon we got now, let's be proud of the Devon we live in and what we actually got. This council has worked. And with Donna coming in at the helm, and this isn't racist, Donna, you know, you're from Scotland, I'm a Devonshire boy, but you're coming here, you're trying to steer us in the right direction, and you're passionate for Devon, and that's what I love seeing. See, people who come into our area, passionate for our area. You love Devon, I love Devon. I don't want to see this new one Devon. We got Devon now. Let the government support the Devon we've got at the moment. Reduce the outgoing debts that we've got. They can do it quite easily. They're not very frugal with their money anyway, are they? Overspending. It's just absolutely bonkers. You know, they could be helping us out here now before we go into section 114s. Because it's coming close. That is a budget thing. 114 is close. We are getting close to being on the verge of bankruptcy. If the government don't food. That's me finished, Chair. Thank you very much.
Thank you very much. I think we need to really try and focus now on looking at what recommendations specifically for our adult social care budget to make to the Cabinet. So I think we've got one more question, and then we'll ask Louise, who's been listening to our discussions, to put some draft recommendations up on the screen. Councillor Tilsley.
Thank you, Chair. Quite a quick question from me. Paragraph 4.11, sorry, page 7. Just mentions the upcoming business rates reset in April of this year. Are we anticipating that to change our, I wrote it down here, revenue support grant this year, or is it a year 2 or year 3 risk? Or is it not a risk? Have we been told that the revenue support grant will rise to mitigate any changes to the business rates? Thank you. Sorry, I put it in, so apologies. I'm worried that the business rate's being reset on the 1st of April, and I'm worried that it might go down the amount of money that we get in our fair funding formula. What is that risk? Am I worrying about nothing?
So the business rate reset is certainly something to be concerned about. So we, for example, have been in a business rate pool across Devon with all of our other councils. So the 2 unitaries and all of the districts and the county council have been in a pool which has protected some of the growth in business rates from going to central government, has kept it locally within Devon. Because of the business rate reset, we've had to collectively, in agreement across all councils, collapse that pool because the risk is too great for us to continue. So we've had to transfer that risk to central government. So we've lost that income. That's already gone from our assumptions. There are other policy changes going on, which is meaning that the districts are finding it harder to complete their business rate estimates for the coming year. So at the moment, we're working a little bit blind on what our local element of business rates will be. To some extent, as an upper tier authority, we're protected from some of that risk because only we get 9% of the local business rates. We're predominantly a top-up authority, as the government call it. So the government take all the rates nationally and then decide on a needs basis what our funding will be. So we're protected to some extent from that risk, but there is definitely risk and it is definitely an area of concern. And but I'm not expecting the government to change RSG again because of that business rate reset. They've already looked at the need and it's built in to some extent. It's that local element of the risk for us, but we won't know that until the end of January.
Thank you very much.
Thank you.
Thank you, thank you. I'm going to ask Louise, who's been listening to the discussions and the questions. I think she's produced some recommendations or some draft recommendations, I should say, for us to consider to potentially put forward to Cabinet. So I don't know whether Louise is able to put them up on the screen for everybody to see.
Can we see that at the back?
Chair, I'm just wondering if you've captured enough the debate that you had on public health reserves. Because it was a significant debate. All right, okay.
Yes, please. So I think, should I read them out, or everybody can read them? So I think number one, should we go through them one by one? I think, yeah.
Sorry, Chair, wasn't sure if you wanted me to read them out or not. So in terms of the recommendations, and do stop me at any point, because so number one, ensure that the budget equality impact assessment be explicit in its inclusion of a health impact assessment so that it fully complies with the council's statutory obligations in relation to health inequalities and the public sector equality duty, and provides effective support for informed decision making. That was building on Councillor McGough's point.
Yes.
And further ensure that the budget risk assessment for integrated.
Does anybody want to make any comments on that first one? Does that looks okay to me? That looks good to me, Councillor Abbott?
I just wondered, in that context, whether you wanted to list in and the inaffordability of housing because it was linked in the discussion, or whether you don't want it in there.
What does the committee think?
In our budget impact assessment that we've published, we make explicit reference to the ratio of house prices to income. So it might be worth mentioning it here as well, because the whole report hinges on that one report. So it might be worth bringing in the specific numbers.
Okay.
So that now reads, ensure that the budget equality impact assessment be explicit in its inclusion of a health impact assessment, to also be explicit about the housing affordability ratio so that it fully complies with the council's statutory obligations in relation to health inequalities, public sector equality duty, and provides effective support for informed decision making.
You happy with that?
Better.
Thank you. Okay, number two.
Sorry, Jess. Councillor Bailey, sorry.
You go.
Ensure that the budget risk assessment for integrated adult social care be refreshed in partnership with Newton in advance of a decision being made on the work to deliver the budget.
So to me, this is like the major risk. And I'm not sure that just ensuring that the budget risk assessment be refreshed, is that specific enough? I'd be looking to, and I know we've talked about the performance board coming to this committee, Councillor Clist, who sits on the performance board, coming to this committee, so that we have oversight of that, as well as doing the work with the standing overview group, whether we should have something in there with, I don't know, Councillor Keeling, who I don't know whether Councillor Keeling would be able to comment on the kind of, so the ongoing oversight.
I think we can help with that. Yeah. I'll put that in.
Thank you, so that we have.
So the committee requests that Councillor Clist and Councillor Keeling provide regular updates for the Adult Health and Adult Care Scrutiny Committee on the work of the Transformation Board and the Performance Board.
Yes, please.
I think, Chair, that sits alongside in terms of consistency. We do have similar updates come on sent, to children as a verbal update. So it just makes that link with the performance board, and it enables the transformation cabinet lead and the cabinet lead for the directorate to basically do that joint update.
Yes, please. Yeah. Councillor Abbott.
Thank you. I find the use of Newton here, where everybody knows what they're talking about, to be a bit like the use of an acronym.
Agree.
And I wonder if it might say the Newton Consultancy or whatever they go by.
And maybe we should say who are the transformation partner delivering the living, that has got a project name, hasn't it? Living Well in Devon.
If we could say, sorry, Living Well in Devon, and we are doing it in partnership. So they are not doing it for us. We have to do it. They're just supporting us to deliver it. But absolutely, the Living Well in Devon would be the correct terminology.
Thank you, Councillor Abbott. No problem. Yeah. Well, I think what I'd really like to do is try and press on, so then we can finish and then it will be lunchtime. Thank you.
Yeah. Can I just suggest that some of the language is pared down? I don't normally I can sort of handle sort of long sentences and gobbledygook. I speak to a lot of strangers in my profession and sort of roll with that. But a lot of the stuff is kind of a bit esoteric in the way it's written, and I'm finding it's not going to have such impact.
Yes.
Sorry, I just thought it might be useful to say that obviously these recommendations, it's recommended, and I think says that they should be read as part of the overall minute. So a lot of the stuff about, for instance, who are Newton and some of the more complex discussions will be reflected in the minutes. So there'll be a link between the recommendations and the wider discussion. So hopefully it'll make it more understandable in that context.
Aye. Jess? Just to carry on the conversation that Fred's just mentions, Newton is mentioned in the full report 6 times, not mentioned as being anything else except a transformation partner in the 5th time it mentions on page 45. Seems a long way in if we're not going to refer to it, and this is a formal recommendation. And
yeah, so I mean, in my minutes, I'm happy to expand on this, and I think any point about the report is probably a bit of feedback for officers to maybe clarify in future reports. I do an action list for officers after, so I'll make sure to pick that up.
Thank you, Fred. Thank you, Councillor Abbott. I think it's about to be loaded up onto the screen, so thank you very much, Louise.
Sorry, it's slightly different because we quickly rewrote it. I believe it's called the Council's Living Well in Devon Transformation Programme, which is
Where it says Living Well, could we add in brackets referred to as the Newton Transformation Partner, just to really, really clarify it? Amazing, thank you. I completely appreciate as well, this isn't going to be the final wording. It's going to be fixed afterwards.
Sandra?
I think the confusion is that the report that I think you're referring to was written earlier. So the Living Well in Devon programme was co-produced with staff, and we hadn't done that work at that point. So going back to our earlier conversation, how do we get staff on board? We're doing everything, including what the programme is called. So that's why it's really important. But I think you can refer to Newton. I would just call it Living Well in Devon, and Newton as our transformation partner. So that will be fine, because that is their role. They are our transformation partner.
so instead of also referred to as the Newton project,
With Newton, the
transformation partner. Yeah,
we've got it.
It's not referred to as the Newton project because it's our project. But Newton are our transformation partner.
Thank you. If you could go on to the next page, please. Oh, sorry.
sorry, I forgot I was supposed to be reading it out. Chair.
No, don't worry, that's fine. I think, so yes, support the Health and Adult Care Scrutiny Committee in their request for regular updates from Councillors Clist and Keeling on the work of the Transformation Board and Performance Board, including data, outcomes and impact for Devon's population. Okay. Okay, yeah, support the Health and Adult Care Scrutiny Committee in writing to the Department for Health and Social Care, thank you, to highlight that Devon receives approximately £39 per head in public health funding, significantly less than most other local authorities in England, to request that this allocation, which is based on a historic formula and historic ways of working, is reviewed on a whole system basis. I think that's the review should recognise where the public health grant is used to fund universal services and fund these consistently across Devon. Furthermore, the review should consider deprivation and wider indices, including rurality and demographic challenges, and provide government with worked examples demonstrating how a review of public health grant funding formula could improve outcomes for Devon's population and strengthen service delivery across the wider system, including social care and NHS, in order to support the request for a full review of the current allocation. Any comments?
Might be expanded to mention the tension between preventative work and acute care, or is
wow.
No?
I think it's probably okay. I think.
Yep.
Thank you, though. And should we go on to the next? Any comments on that? So cabinet number 5. Committee asks the Cabinet Member for Finance and the Cabinet Member for Rural Affairs, which includes public health, to be explicit in future budget reports of the elements of public health funding relate to universal services. I'm not quite clear what that is.
Sorry, Chair. During the discussion, there was conversation that the public health grant supports the delivery of universal services. So that's not just about deprivation and morality, that's across the whole of Devon. There are some elements of the public health grant that funds more specific need based on deprivation indices. So it was splitting it out to be really clear about what's universal services and what's more targeted services. But if that doesn't make sense to the committee, that's what I picked up at that point in time. Sorry.
No, it's fine. I think that there was more discussion around the reserve, the use of reserves and the finite nature of reserves, but how we capture that in a recommendation to Cabinet, because I am concerned that once that money, even if we maintain a balance, we're basically using a finite resource. So I don't know whether maybe Councillor Dawson, because I know that you were raising questions about the reserve as well, would like to include any specific recommendation to Cabinet.
I think maybe a really quite specific goal of what that reserve needs to be in future years.
Yeah,
potentially, because I know there's a limit to what planning we can do, even with a 3-year settlement, but beyond that as well. So maybe not quite a policy, but maybe what's a comfortable buffer to have for those unforeseen pandemics and things that we don't want to see come back again. So what percentage is okay to be used in transformation and what actually should be kept as a buffer, because I think that will help us, and will also help us justify as well. If we're seeking more funding, we can also justify why we have those reserves.
Yes,
well
I think
forward.
that's.
I think the other issue that came up was about, I think officers were saying that examples that were given when they were looking for more funding or justifying funding, the examples were all about adult social care or whichever it was, whereas actually they could have given examples across the board, and it resulted in it not being acknowledged by government. There was a need across the board. So I think that's something else that we need to put in there or speak to officers about making sure that there's some learning there, that actually if the need is across the board, then those examples need to be specifically across the board. So there's no wiggle room for government to then say, actually, you've only given examples about adult social care, so therefore we can see it's not needed in other areas, and make those kind of dangerous assumptions that we're going to end up paying for.
Thank you. Yeah.
So it's statutory for the use of the grant, so we can't set a policy on this. So I think wording may just need to be shaped a little bit.
So the use of the grant is statutory, but presumably this council can decide the extent to which it maintains a reserve or not on the public health grant.
So the reserve was built up from the ring fence grant, so we can only spend that reserve on services that deliver public health outcomes, and we're monitored on that. The actual level of reserve, the regional public health director has asked each local authority, each director of public health, Steve for us, to hold 5% as a minimum. We could decide to hold 2%, but we would have to, for instance, but we would have to discuss that then with the regional director. And 5% as a rule of thumb is probably not far adrift. So I don't have any issues with the reserve going down to £2 or £3 million. I think that's more than adequate to cover the risk that our public health service is going to face. So I'm not sure that there is a recommendation here for you, if I'm honest.
Right.
Just based on what the Director of Finance and Public Value has just said, and thank you for that thank you for more clarification on that. There's a lot to take in across the 3 scrutiny committees. Are you content with number 5, or would you like that removed?
I'm content with that. I don't know what members have any comments. No? Okay. Number 6. In partnership with in partnership with the Health and Adult Care Scrutiny Committee, the Cabinet to write to the Department for Health and Social Care on the implications of rolling the Better Care Fund into the Revenue Support Grant. The letter should set out the case for Devon, including the potential financial and operational impacts any loss of or reduction in funding would have on adult social care, local health partnership and system-wide service delivery in an already stretched system that is vulnerable to budget shocks.
So the Director of Finance gave a very helpful indication of how this might shift, because although I think you're going away to find out the original criteria for the Better Care Fund, essentially it was money given to help reassure the NHS that local government cuts weren't going to adversely impact it. So good luck with finding what the original criteria were, but what I think the discussion highlighted is the real, as this in to the baseline, it becomes subjected to the same criteria, i.e. becomes deprivation related. So in a system when you're already really tight, and remember the amount of attention paid to Better Care Fund is probably disproportionate to the amount of money in it. If that drops, that puts you at really significant risk together as a system, if that makes sense. It was just pulling that out. We may not have done that well, but the sort of penny dropped during the really good explanation that this could be similarly on a downward trajectory because it's rolled into baseline and therefore cause real tension at the interface with the NHS, if that makes sense. So it was just trying to pull that out. Because you were being so good in spotting things. It's
Director of Finance.
Yeah, so I'm not sure if you want to write a letter, then lobbying is good, obviously. I'm not sure I would restrict us to just focusing on that Better Care Fund grant. I would probably broaden it to look at wider funding. And we certainly had the conversation around the sparsity, the remoteness factors only applying to adults. But of course, that for you is good, but for the rest of the authority is not good. So I would probably broaden that into writing a letter about the additional cost of running services in remote areas. I think that might be the way to go rather than honing in particularly on the Better Care Fund.
Okay.
If that's helpful.
That is helpful.
Yeah, that's Better Care Fund to the list, if that makes sense. I think that was something you really identified.
Councillor Abbott.
Councillor Bailey, when you read out that paragraph, you sort of automatically corrected the last phrase to "an." Which do you want?
Is it possible, Louise, to add in there about the inherent unfairness of the fair funding? That was a lot of what the conversation was around.
So number 7, the Cabinet in partnership with the Health and Adult Care Scrutiny Committee write to HM Treasury, copy to Devon's MPs to highlight that the assumptions underpinning the current provisional local government finance settlement requires councils to apply the full 5% tax increase, isn't it 4.99, including the 2% adult social care precept built in for the next 3 years. The approach assumes that council tax can absorb the escalating financial pressures facing adult social care. The committee considers these assumptions to be unsustainable and calls for reform to develop a fairer, more resilient funding model for social care that reflects actual demand and the true cost of delivery. Any comments? That sounds fine to me. Apart from, I think it should be 4.99%.
The 5% number just came from paragraph 4.4, and it just talks about going up to the recommended threshold of 5%, which is why we're sticking at 4.99.
Is that okay? That's fine. Okay. Councillor Abbott.
Is this referring to the funding set so many years ago and has just been kept running forwards 2016? No.
This is the new funding, the so-called fair funding.
You're referring to the public health funding, which is from very old data.
Okay, number 8. Gosh, Cabinet work with Devon communities, provider market and VCSE Assembly to increase awareness, embed in communities its strength-based approach and model to adult social care, and more proactive engagement with self-funders to promote independence, improve outcomes, and support the sustainability of the wider adult social care system. You see, I think that's fine, but I would like to see, they're very specific. I mean, they're very good organisations, the ones that we're giving grants to, including one in my division, which is Ottery Help Scheme. But I think we should be encouraging Cabinet to kind of roll out a wider scheme across Devon, promoting independence, and so that ultimately will strengthen our communities and also reduce costs for the council and improve outcomes. And I think Sove may want to speak.
Yes, I was waiting for a question on this. So there's a few grants that are listed in the report, but there are lots of other grants that through sort of accounting anomalies don't appear in this one. So they might come through the Better Care Fund, for example. So just through adult social care, there's over £200,000 invested in the voluntary sector. And that's not including things like contracts where we've had a formal contract with the voluntary sector. So we had our budget consultation with the VCSE last week, and we meet really regularly with the VCSE Alliance. And one of the things that we've committed to do is to do exactly that, to look at the spend in the whole and make sure we're using that money to in the most strategic way for the best outcomes and targeted where it's needed, rather than continuing legacy arrangements. Doesn't mean that legacy arrangements aren't right. They may well be exactly the right thing, but we need to have a more strategic overview of the whole, and the VCSE Assembly are really keen to work with us on that.
Thank you. I think that's really important, because you can't actually pick out, can you? Like at the moment, it's kind of individual pots of money and, from the Better Care Fund and wherever. So to have a more kind of cohesive and comprehensive scheme supporting our VCSEs would be really good. So I don't know how we can just, but I think we should. Okay, so the rolling out of a Devon-wide scheme. So, opportunity for anybody to add anything, take anything away, comment. Councillor Rogers.
Thank you, Chair. Can we just comment within the recommendations, we recognise our hard-working staff and the pressures they're under, and refer to they are important to our organisation?
I think we have. At the beginning, we welcome. Thank you.
Sorry, Councillor Rogers, it starts by saying the Health and Adult Care Scrutiny Committee expresses their thanks to the Devon County Council officers, including officers and staff in finance and public value and integrated adult social care and public health, for their commitment and hard work with Cabinet members to develop the draft budget presented today.
Thank you. I didn't see it. Thank you for that.
So, are we happy to move these recommendations? I think if we go to a vote, I'm looking at all the members. I shall propose them. And Councillor Hodgson, second. And if we move to a vote, everybody in favour? Thank you very much. Thank you very much to the committee. Okay, thank you very much to the committee, and thank you very much to other councillors here and all our officers. Thank you so much